All right, folks, it's time for another online dinner party. Hope everybody is having a lovely Wednesday afternoon. That's right, it is Wednesday afternoon. Hoping that some guests will be appearing very shortly and that we'll have some engaging conversation with them about a lot of things that are going on in society and all of that. I do know that some of them said that they would be on in the latter part of the show and all of that, but definitely looking forward to some engaging conversation, including with a return guest, Delon Canterbury, who is doing some great work in the field of getting those folks vaccinated and all of that. So definitely looking forward to this conversation with him when he comes on, and he'll talk about some events that are going on right here in Durham, North Carolina. So I'm definitely looking forward to him being one of the guests, and there are some other guests that I'm expecting to appear as well. So definitely looking forward to some amazing conversations and some very enlightening conversations in that regards as well. So definitely, hopefully, everybody is having a great time and definitely enjoying the conversations that we will be having and some of the amazing guests that'll be coming our way. I just came back from having lunch over at the Washington Duke, and that was a great time. We did get a little bit of exercise in because that was a nice little walk and everything. I think they said it's about a 35-minute walk, and I would say that for me, it was probably about a 45-minute walk because, not as a spring chicken anymore. So those walks might take a little bit longer than it was expected, but definitely some good exercise and some much needed exercise as well. As a matter of fact, I need to get out more often. As a matter of fact, I walked by one of the parks that I used to walk at regularly as I was walking in that direction and saying, hey, I need to get there more often, even if it's nothing but to walk around the couple of ponds, because I think there are two ponds that are back to back in that particular area. So might have to start doing that on a more regular basis. So definitely, I'd love to hear what folks are doing on this day here in Durham, North Carolina. It's about close to 70 degrees. I think it's like in the high to mid 60s, and it is definitely some great things that are going on in that regards and other things along that line. So I'd love to hear folks' thoughts about what they are doing and how they are doing on this particular day. Because, like I said, it is a very warm day for the first day of December. I did notice that it is a very warm day here for the first day of December. So I don't know what other folks are thinking about this kind of weather that we're having and whether they are even noticing that it is much different than usually and all of that. By the way, I know a lot of people have been paying attention to the Omicron variant. And like I said, I am hoping that Delon Canterbury will be coming on and talking about what is going on with the COVID cases and what is going on in terms of us trying to get people vaccinated and all of that. Because there are some people that are still having vaccine hesitancy and things along those lines. So definitely that'll be part of the conversation that I'm hoping to have with Mr. Canterbury. By the way, California has confirmed the nation's first case of the Omicron COVID-19 variant. The presence of the variant on U.S. shores comes just days after Omicron was initially detected in South Africa, and its arrival stateside was not unexpected, according to experts. White House Chief Medical Advisor Dr. Anthony Fauci announced that the person who tested positive was fully vaccinated and had arrived in the San Francisco Bay Area on November 22nd on a flight from South Africa. The individual tested positive on November 29th, according to the Centers for Disease Control and Prevention, and that is what officials said earlier today. So that is some of the things that are going on. I know that definitely one of my colleagues here, Steve Arau, is always talking about how this is like a hydra. After one head is cut off, another head grows back, and he parallels it to that hydra monster and all of that. And definitely Regina Phelps, who is a person involved in science and all of that, she was saying COVID-19, a needle in the haystack. California has built up a substantial network of laboratories to look for concerning variants over the past year. And now the scientists running those labs are developing creative new strategies to quickly identify Omicron. So at the University of California, San Francisco, one team is studying wastewater, including effluent from San Francisco International Airport, for signs of the newest variant, which has not yet been found in the US, or at least not until now, but is likely already here. The head of the Stanford Clinical Virology Laboratory hopes to narrow the search for Omicron by focusing on one mutation that it happened to be missing. So some scientists plan to use a simple diagnostic test to speed up the hunt. Across the state, many public health laboratories are prioritizing viral samples from people who have recently traveled from Southern Africa, where the highly mutated variant was first spotted, for further genomic sequencing. So it'll be interesting to find out what people are doing in that regards and how things are going in this latest version of the coronavirus that we are dealing with and all of that. So that is the latest that I'm hearing from that particular news story. If you're hearing other things and would like to share your thoughts about this, we would love to hear from you as well. We love hearing from our various people that are involved in a number of parts of the world and the things that they are finding of interest as well. By the way, Capital One is saying that it's going to get rid of overdraft fees. And I know a lot of folks who would be glad to see that happen. I know that overdraft fees have hurt me big time and still continue to hurt me because sometimes I'm one of those folks that will, think of the money after the fact, and then those overdraft fees will hit you and all of that. So I know that I had probably lost a whole lot of money because of overdraft fees and things along those lines. But Capital One is becoming the largest U.S. bank to get rid of the overdraft fees. And it's definitely going to be interesting to see whether other banks follow suit. Overdraft fees, which typically range between $25 and $35, are applied every day, every time a customer exceeds their balance. While extremely lucrative for banks, they have long been criticized for disproportionately impacting vulnerable consumers. And as one that has been impacted, I can definitely agree with that kind of thought. As a result of the policy change, which will go into effect early next year, Capital One expects to lose $150 million in annual revenue. So that is one of the things that is going on there and along those lines. So definitely it'll be interesting to see, like I said, whether other banks follow suit or not. So that is going to be very interesting to see. By the way, Bradley Leamer, who wrote a book entitled Beyond Good, said that while it's still a drop in the bucket for a large incumbent, it is a good trend to see more large brands drop excessive consumer fees and instead focus on value added solutions designed to embed more financial health into the business model and less extractive penalties. The smartest brands will look at moves like this as an opportunity to truly serve their customers and their communities, not penalize those most often financially marginalized. So it'll be interesting to see, like I said, if other banks follow suit or whether this is a one off with one of our major banks and all of that. And by the way, Carlos Mark Vieira, who is leading the fight to end unpaid internships, says that as someone who personally had to pay several overdraft fees that added up when I was in school and started a company called Pay Our Interns, he is proud to bank with Capital One. This is what you call putting your money where your mouth is, and I would argue a racial and economic justice issue. It means nothing if a bank hires a chief diversity officer or office throws a couple of bucks to some nonprofits, yet continues their overdraft policies that disproportionately impact Black and Brown families. It's time for the other banks to do the same thing. So it'll be interesting to see what other people agree with that and what their thoughts are in that regard. So it'll be definitely interesting to follow this news story and to see what happens in that regard. So I'm definitely looking forward to seeing what people's thoughts are in that regard and what other people will be doing in that sense. By the way, the CDC has definitely looks like it's going to be warning on new travel rules. That's right. We were talking about what's going on with the pandemic and concerns about the Omicron coronavirus variant are ushering in a new wave of travel restrictions globally. While discussions are still in progress, the U.S. is considering requiring all air travelers arriving in the country to show a negative COVID-19 test taken within 1 day of departure, regardless of their vaccination status, according to the Centers for Disease Control and Prevention on late Tuesday. So that was late yesterday. The Washington Post reports that other travel requirements are also being mulled, with President Biden expected to detail the changes on Thursday when he outlines his plan for handling the pandemic over the winter. So we do know that, it's definitely getting ready to go into winters, which is cold and flu season and things of that nature. So definitely, a lot of people will be paying attention to how we handle it as this whole thing continues and all of that. The World Health Organization recommended an evidence-informed and risk-based approach to travel restrictions. Japan, South Korea, and Hong Kong also announced expansions to travel curbs. All passengers 12 and older must now present proof of vaccination to board a plane or train in Canada, which also expanded its travel ban as well. So, one of the things that a person, Nitho M. Eldus, who is a digital editor at Router, says was that air travelers to the U.S. might have to face tougher COVID 19 testing rules as the country is moving to require that all passengers entering the U.S. show a negative test performed within 1 day of departure amid those concerns about the Omicron variant of coronavirus. Here are the existing rules as they exist. Vaccinated international air travelers can present a negative test result obtained within 3 days from their point of departure. All foreign nationals must be vaccinated. Unvaccinated travelers must get a negative COVID 19 test within 1 day of arrival, and the new 1 day testing requirement would appeal equally to U.S. citizens as well as foreign nationals. A CDC spokesman confirmed the agency is working to modify its global testing rules for travel as we learn more about the Omicron variant. A revised order would shorten the timeline for required testing for all international air travelers to 1 day before departure there in the United States. So definitely, it does look like things are going to be gearing up in that sense, and definitely, I'll be interested to see what folks' reactions are to these new rules and these new regulations and all of that. So it'll be quite fascinating to see what people have to say about these new changes and whether they are in favor of them, not in favor of them, or what their thoughts are in that regard. So, like I said, hoping that Mr. Canterbury will come in and talk about an event that he's got going on very shortly. As a matter of fact, I believe it's coming up in another day or two and all of that. As a matter of fact, it's going to be taking place on December 4th. So definitely, Dr. Delon Canterbury is the founder of Geriatrics RX and an executive board member of the African American COVID Task Force. And along with A.M. Better, North Carolina Medical Assistants or Medical Assist, UNC, and Duke, and several community partners, they are hosting a free OTC, COVID, flu, and prescription medication giveaway for patients this Saturday at the Fisher Memorial United Holy Church of America on December 4th, which will be 3 days from today. So that'll be on Saturday, and that is from 9 to 2 in Durham. So they are focusing on serving communities with decreased access to health resources and definitely looking to have a lot of people try to make it to that event and all of that. So they are saying that there's going to be some things going on with that. And like I said, I am hoping that he'll be coming on very shortly to even talk about some of the things that they're doing in partnership with Porch Durham to donate food for families by Interfaith Food Shuttle. And they're also donating 1,000 food kits valued at $99 to $100 each. So definitely hoping that he'll be able to come on and share some of this news as well. So I did send him the link and all of that, and I'm definitely hoping that he'll be joining very shortly to share some of the things that are going on in that regards as well. So definitely, hopefully he'll be making an appearance very shortly and can share more about what is happening with this particular event that is taking place right here in what we like to call the Bull City and all of that. So hopefully we'll be getting him coming in a very short time frame to share a little bit about this amazing news and how this event is going. And like I said, I do know that some people are still dealing with vaccine hesitancy as well. So definitely hoping that folks will be able to find out that they do not need to be as hesitant, and maybe some light can be shed on why people might be hesitant and some things that might get people to not be as hesitant if that is the case and all of that. If you're watching and you've got some thoughts around these issues, I'd love to hear your thoughts as well, because I know a lot of people are paying attention to a number of things going on in the world and all of that. So definitely, if you're watching and you have thoughts around this very important issue, I would love to hear your thoughts about this and everything else that we are bringing up in this particular report here on International Broadcast Media. By the way, there is a California residential shakeup. That's right, a popular pandemic narrative. Californians fled the state in droves in search of more space for less money. The reality, according to LinkedIn, isn't quite so clear cut. Residents did pack up and move in large numbers, but most stayed within the state, according to the New York Times. Instead of jetting off to Austin or Miami, Californians were more likely to move from expensive cities to nearby and more affordable counties. San Francisco, for example, saw one of the largest pandemic induced exodus, with many residents moving to nearby suburbs. So that is what some of the folks were doing. They were moving to those suburbs and all of that. So love to hear your thoughts and whether you are seeing people doing that or not doing that, and what your own thoughts are in that regards. Matter of fact, Marco Scanavino, who used to work with Google and Armour, was saying that many people are moving out of San Francisco, New York, Paris, London, and other metropolis. Some are moving to the suburbia, and some to other southern and cheaper regions of the country, and some are moving to islands like the Balearic. With almost every business related job possible to do it remotely, is moving to a big city still a good investment for networking and creating new opportunities. And it does look like more and more people are moving to places that they know they will have remote access and things along those lines. But then you got the issue, as we were talking about doing lunch this evening, of there being a lot of places that don't even have the correct kind of internet infrastructure and things along those lines. So we definitely hope that that is being considered as well. So definitely these are some of the things that folks have on their mind, and I'd love to hear from our listeners and our folks that are watching here what their thoughts are about these various issues. By the way, are you wondering what the top jobs are to get ahead? Well, people are actively switching jobs and even fields during the great reshuffle. Many are searching for more fulfilling positions, but they may not want to lose too much professional ground when taking a leap. So, definitely some of the jobs that people are looking at, because they've got the most rapid promotion rates, are product management, marketing, program and project management, accounting, and human resources. So definitely it'll be interesting to see what happens in that regards. And by the way, Andrew Seaman, who is a senior editor over at LinkedIn News, said that promotions are milestones in our professional lives. They are just not recognition of our hard work, but their promotions also mark progress in our careers. With the help of different things, we're being able to see how it is impacting folks in jobs, industries, and cities. So let us know in your mind whether these are the fields that you are thinking that you might want to go into as well. So I'd love to hear your thoughts about this and all of that. Lydia Citron said that if the great resignation is actually the great reshuffle, then where does that leave you? Are you considering a career pivot to a more in-demand field of work, as mentioned, or is a new career bringing hope, possibility, and enthusiasm? And the end of the question, am I completely starting over? Anytime you make a significant reputation pivot, as you would be doing in career pivot, it's critical to bring forward the qualities, characteristics, and reputation successes that are positive, memorable, and valuable. And at the same time, shed the aspects of your reputation that don't serve the new audience or a new focus. As you make a career pivot, she was saying, carefully consider step one, clarify your career and life goals and ask yourself, how do you define success? Step two, use your current reputation and skill assets. Inventory what you're known for today. Solicit feedback from peers on how you're known. And step three, decide which assets are most valuable to take with you into your next career. Step four, understand your new target audience. Who are they? What do they need to know and feel from you to engage with you? And step five, Create your strategy. A career pivot takes careful planning. Don't leave it to chance that others will find you relevant and compelling. And always remember skills, certifications, credentials, and experience help grow your career, but who you are and what you stand for matter greatly to the people looking to work with and be led by someone like you. Be clear on your values and your goals before making that pivot. So that was some very solid and very beneficial advice that many folks may want to take an idea and a look at and all of that. Wanted to get to another news story real quick, and we do have Delon in, so we're going to get away from our news story breaks and all of that and bring Delon in. He's going to talk about this amazing event that I just mentioned and everything, and looking forward to our conversation in that regards as well. So how's everything going, Delon? Glad that you were able to make it here. I know that you got a big event going on, and we were actually just talking about this on our news story earlier, because we were talking about how, for whatever reasons, and I know that this pandemic seems like it's been going on forever, that there are still people that are having a vaccine hesitancy. And I know that even my friend Steve Rowell was talking about that. And part of the hesitancy is boosters, because I know I've got both of my shots. I have not got the booster yet. I know I need to get the booster, but folks are now saying, do we have to get a third shot? Do we have to get a fourth shot? Will there ever be an end to the shots and all of that? So Delon, I know you're doing this amazing event. I did mention a little about it as I was waiting for you and everything, but is this still something that you're finding a lot of people are hesitant about, particularly in our communities?
Yeah, Mark, thanks so much again for having me. And to be honest, it's a fair question. The medical community has the same question. Do we need to prepare for another booster? Do we need to reformulate what we have now? And we also appreciate that everyone's tired of this, am I right? So
Yeah.
at the end of the day, we're going to have COVID for a while. It is going to get better. So I think it's a little too early to tell. I don't think we have to start panicking in the moment. I think I even read an article today that we just got our very first case of Omicron in California. And so we still don't know what that really means. We know it's here. We know it can probably spread, but that does not mean our vaccines aren't working. And so the emphasis really is for those in preparation for this, is to consider getting your booster. If it's been 6 months, if you had Pfizer or Moderna, or if it's been 2 months since Johnson & Johnson. And of course, you can always mix and match if you want to play that game too, and there's no problem with that. So the truth is, the vaccines still very much work. We just don't want to raise too much panic unless we have more information. And we'll have more in the next 2 or 3 weeks. But it's true, people do want to wonder, are we going to keep getting boosters every year, every couple of months? We don't know yet. I will say that these vaccines do give a pretty strong response. Now, why not have more of a stronger response if that's going to keep you safe than chancing it if you may be on the lower end or 8 months out from your last vaccine, right? We know that it will decrease over time. That's just what we know for facts. After 6 months, the efficacy lowers. And why chance that? Why put that at risk? And so just like how you get a flu shot every year, I'm not saying that's what the COVID vaccines will be, but in this instance, it's safer to be prepared than not. So I'd rather you get it than wait.
Now that makes a lot of sense. What do you say to those folks that have had incidences for whatever reasons, that they had people in their family that might have had pre-existing conditions, and then they had an adverse reaction? In some cases, I even know of a person that was very close to them passed away. So therefore, they are very hesitant because of what some people would consider anecdotal evidence and everything. So they're very much concerned about taking the vaccine because they're like, say, they had a family member that took it, they got sick, they're no longer here on the earth anymore. And then they give you kind of this anecdotal evidence. And like I said, I could mention one case, but there's definitely others that I'm sure are that way as well. And we still have people that are upset in our community because they remember some of the history of testing and things along those lines. So they'll bring up Tuskegee, they'll bring up some of the things that would happen in our Native American communities and things along those lines. So as one that is definitely still advocating that people get the vaccine and definitely try to get it to the maximum amount that we can get so we can return back to some form of normal. I do think that I agree with many people that it's going to be a new normal. I think that even job market is going to be very much hybrid as people try to probably work from home where they feel that they have more control over their surroundings than they would going into an office or even a school. But I was just wondering your thoughts when people bring up these kind of points of the reasons that they are against the vaccine.
Sure. I mean, as a pharmacist and active member of the African American COVID Task Force, you're going to get all types of questions. And the most important thing I've found in this space is to really just have a lens of humility and empathy. And you got to listen and feel where people are coming from. If your experience is that, you can't invalidate that experience. And so you need to come from a lens of care and a lens of concern. And when you have that established trust, and if you're consistently messaging on some of the truths behind some of these myths and debunking some of these theories that are out there, you got to understand, not everyone just has access to a healthcare professional just right next door to ask all their pressing questions. And so people get it from other people get it from social media, people get it from, sadly, politicians. It's a lot of moving pieces here. So the trust is what needs to be established, the empathy, understanding that, yes, there was a Tuskegee. Yes, that we have had disservices done against Native American people in our own healthcare system. Yes, we've had, basically projects where we've sterilized minority communities here in North Carolina. You got to talk about the elephant in the room. You got to talk about what the history is, but we also need to make sure we're confident and not extrapolating from a past grievance to what's going on now. And what's going on now is a global pandemic that doesn't care about your race, your ethnicity, your culture, your social economic background. It doesn't care what country you're in. Its job is to multiply, survive, and reproduce. And when we start seeing things more as a community problem, more of a global problem, more of a human problem, it takes away some of the biases that we come into this thinking. Some people think this is just a ploy to get vaccinated and make money for the pharma. Of course, they're going to make money, but we have evidence that we are saving lives with this. It's hard to conflate a one-off instance and assume, well, it must have been the vaccine. It's really hard to do that scientifically, and even harder if you're just assuming, well, that something happened, so it must be that. And so we have a great surveillance system. We're not the best, but we have a great way of tracking reported outcomes, adverse events from these vaccines. And we can still say to date that people who are unvaccinated have a 12 times higher risk of being hospitalized and a 6 times higher risk of dying from COVID. And the numbers don't lie. That's what we're seeing in the hospital. That's what we're hearing in our community meetings. And so again, it starts from looking at the big picture, looking at what's happening now, and what can we do to actively and consistently provide trust, build empathy, and debunk misinformation when it comes to our door.
And speaking of misinformation and things that are very much interesting, I had a friend and they actually do a show here on our platform on International Broadcast Media. They just recently came from Kenya. They were there for a business conference. And one of the things that they noticed that they wish that we did more consistently. And I know that Ms. Cohen, who is stepping down from her position in terms of being the head or the face of our state here in North Carolina, of the pandemic task force and some of the things on a state level, that she's stepping down from that position. But in the early days, she talked about masking and being consistent with the masking and even being consistent with that. And one of the things that Barbara H. Smith noticed was that she went to Kenya and they were like consistently testing people, whether it was a temperature check or whatever. And that was in Kenya. And she also noticed that, they were very much tight-fisted, and they weren't the only country about their masking rules. If you weren't wearing a mask, there was a good chance you were going to go to prison. And as she put it, a Kenyan prison is not any trip in the country club kind of level. As a matter of fact, it apparently is much harsher than an American prison. And we talk about how bad American prisons are. So apparently they were being very enforcing of their rules and things along those lines. And I know in the early days of the pandemic, we talked about even having these kind of rules being enforced and all of that. And I can tell you that there's a restaurant around the corner from me. There is a temperature check monitor there, but and the couple of times that I've eaten at that particular restaurant, I don't think that I've ever seen anybody actually bother to take their temperature. And the same thing with one of our local universities, because that has those monitors and things. So I mean, we can put them out there, but if nobody's using them, are they really being useful and all of that? So I was just wondering, do you think that we might need to be a little bit tougher on some of the basic principles, like what we talked about in the early days of the pandemic, washing your hands, getting a temperature check, which I know is not foolproof, but it at least shows some ideas of whether you are having some symptoms or some of the things that may show that you've got the virus and all of that. So do you think that as one on the task force that we need to maybe tighten up our rules and enforcement of just the basic principles?
I think it's not more so tightening up, but just a reinforcement of washing our hands, social distancing, and wearing a mask. I mean, that's kind of what we're doing. So I feel like it's not too much of an ask now. We still have some states that think differently. And so if they don't mandate it, then hey, we do what we want. Luckily, we have a little more flexibility here, but some counties don't. And so there's a fine line of quote unquote encroaching on human rights, which we like to throw around in this country, and public safety and public health. And when your actions impact all, some people want to be more draconian. Some people want to leave it up to the people, leave it up to the states. That's more of a political answer. However, the basics still matter, and we have evidence that those measures do matter. For instance, wearing a surgical mask instead of a cloth mask is not preferred. We almost think that cloth masks don't really do much as much as surgical, and so it's better to have a surgical mask. Washing hands is still one of the easiest ways, apart from it being airborne, to spread. We know that when we touch our eyes or nose, we're going to be inside, it's getting cold. These precautions can help reduce and minimize risk. And of course, the same for social distancing. So those basics still lie. I don't think we necessarily have to have a Kenyan rule where we're putting people in jail for not following them. Because frankly, we know that vaccinations and the combination of these social behaviors is what's going to stop this pandemic. So I think it's a mixture of both policy and really just having a change of attitude and seeing this as a bigger community issue.
Along those same lines, one of the things that I'm curious about is, and I don't know how you would even enforce it, but don't we need to have some sense of consistency as well? Like I just met earlier today, or I've known him for a while, but it's a person that used to have church services at the Hayti Heritage Center, which is one of the places that I work at. And
Mhm.
now I was asking him about their current venue, and he was saying that they were not doing necessarily as much spacing as you would expect in the main level. They did do it on, I think, the second floor, the third floor. I think that is a 2 or 3 floor building and everything. But then you see that, you watch some of the sports games, and you don't see that they're necessarily doing the kind of distancing that is being recommended. I know that I'm on the board of the Carolina Theater, and we have definitely put in policies that people have to be seated a certain amount of
Mhm.
chairs away from each other and everything, but I don't know that we're being consistent. And I just use those two as the example. So isn't part of the issue that we also need to have some consistency in the ways that people are doing it? Because if you got church A doing it one way and church B doing it this way, or you got sports team A doing it this way and sports team B doing it that way, then it seems to me that we're going to have an even harder time fighting what my co-host on the morning show that we do, the news show, calls this new Hydra, because every time we turn around, there's a new variant. And it seems like
Sure.
after you cut one head, there's another head that is popping off and everything along those lines. So I was just wondering, do you think that part of it is we also need to get not just consistent messaging, but also consistent actions from our citizenry?
I think it will help. I'm not sure if that's going to solve all of our problems. I mean, we couldn't even agree if the virus existed in the first place. So
Right.
getting everyone to agree um, can probably worsen the problems and lead to more defiance in some ways. I'm not saying I personally don't think it won't help, but I do see that when you start telling people what to do, they're going to be a little more resistant to that. So that's why it's such a fine line in our country to just balance freedom and then the safety of others. Especially so, I mean, we want people to social distance and do what they need to do in public settings, but if you go to some parts of this state, they don't care. So it's like, what are you going to do? to really move the needle. And frankly, my concern is putting access to the communities that don't have access and really focusing on the unvaccinated population and emphasizing and re-educating on what some of their hesitancies are and talking through that along the way. And doing that consistently, I think can move the needle a bit more than just draconian, you're not wearing your mask right, so XYZ. It's just a hard thing to really predict, but I think it may help. I think the biggest issue is who isn't vaccinated and how can we get them into our doors.
And that's along those lines. I know that we definitely had. How are we doing in terms of? And it's actually two-part question: vaccination in our own communities, meaning those of the Black and Brown community, versus some of the other communities that are out there. And then the second part of that question, because I do have family members in this group that I'm getting ready to describe as well, are we finding it harder to vaccinate people in rural counties? Because a lot of times, rural counties, there might not even be that much of a closeness in terms of the way the houses are structured. So there might already be, because of the way that the neighborhoods are structured, a little bit of social distancing because they might be several acres apart from each other if they're that far away from neighbor to neighbor and all of that. But I was just wondering, are we having a harder time reaching people in our communities, meaning the Black and Brown communities, and are we having a harder time reaching people in the rural communities?
No, it's a great question. I can easily say that our rural communities are still very much battling with some of the examples we've discussed previously. We have members on our task force that are all across the state. And so we have one of our partners is doing a lot of great work. Her name is Shakita Lazane, and she works with Shackle Free. And she's over in Duplin County in Jacksonville, and she's seeing it day after day after day. They can't even get enough vaccines in their own county to vaccinate the marginalized and rural populations. And so the access is there, the barriers are there, but the worst part is they don't have any consistency in the health department. There's like the health department is still dragging feet to put in measures to prevent the spread. And so it makes it harder for her to do her job and try to get people vaccinated. And as you can imagine, more people will become sick and more people will die as a result of this type of attitude. So there isn't any type of assertiveness when it comes to vaccinating. And this is a more rural part of North Carolina. And I'm sure that could be spoken to for several rural parts of North Carolina, especially when we know politically that red counties are less vaccinated than the more bluer counties. Now, in terms of the actual data around here in Durham, North Carolina, and in fact, a third of North Carolina counties, we are seeing more upticks in Black communities. We are seeing more. However, it doesn't necessarily mean that that is the solution, but when it's looked in relation to the other majority, which are the white people, it's still grossly showing disparities. So I do think that we are improving. We are seeing more of an uptick. I think some of it being Omicron in the news, some of it maybe just simply people just having their hesitations a little bit more lower now because it's been around and they're realizing people aren't dying. We've vaccinated millions of people across the world, and they were not seeing the reported third head or third arm growing or deaths from the actual vaccine. So I think we are getting a little bit of an ease, but we still got to talk about the basics, and that's access, that's resources, that's infrastructure, funding, incentives to really subsidize community health workers that are moving the needle on these and going to people's homes and doing the legwork that's needed to really put this into the next wave of resolution.
Because I noticed that one of the incentives that y'all were given, at least on this event on December 4th, because we do know that there's also supply chain issues, was a chance for folks to get much needed food. And so I did see that that was something that was being tied in to as well. So I'd love to hear your thoughts about how that was working and what y'all are doing in that regards, because I did notice that there was like entire like whole grocery amounts that were being given away, and that seems to be a way to get people into the door, if nothing else.
Yeah, we're trying. As you're well aware, Mark, there is a national shortage with food banks across the U.S. So we are hoping and praying that we're going to give away these free food boxes. We've partnered with two strategic people. We have, I believe, Porch Durham, and I also believe the Interfaith Council and Food Initiative. I'm sorry, I'm messing up the name, but we're working with them and other local banks to get food for this event. And for those who don't know, again, this is Delon from the African American COVID Task Force. We are having a COVID flu vaccine booster and over the counter medication giveaway. So in partnership with North Carolina MedAssist, Faith Church, and Am Better, we are not only getting boosters for people out there, we're giving free flu vaccines. We're also giving vision screenings for people and health education resources. So you're gonna have a bunch of community nonprofits out there tabling and giving you stuff you may need. And the kicker is there is registration for people qualified to receive up to a year's supply of free prescription medications as well. In addition, we are hoping our food banks can come through. We are still getting some food kits out there. We have nearly over 1,000 bags of over-the-counter medications valued at about $100 each just to give away. So you can literally just come up, no ID required, get some free stuff, in addition to us giving away free food kits as well for families, which is the perfect timing right now with the holidays coming up. And this is all Saturday from 9 to 2 at Fisher Memorial United Holy Church here in Durham. And of course, we'll be there early, but we'll be there from 9 to 2. Get your free shot, get some free food, and why not get your vision and also some free over-the-counters as well.
Wow, that's a lot that they can get if they make it to that event. That's a whole lot of amazing things that are going on in that regard. I know a lot of folks have, I guess, gotten maybe some people would call it COVID fatigue. So we are seeing more and more people that are getting out and about. I know that I went to Washington Duke earlier today and saw some people over there, and most of them were masked up and things. But I was just wondering, do you feel that at what point do you think that we can say that the pandemic is over? I know we've got a new variant, so it won't be over probably in 2022. As a matter of fact, it definitely won't be over in 2022. But do you think that we will ever see an end to this? Because like I said, if you study the history of the Spanish flu, which was very similar to what was going on, that lasted, I want to say, for about 10 years. And we're only in year 2 and things of that nature. So is this something that we're going to have to be facing and fighting for another 8 years? I know that we're in a much more modern time, so hopefully we are quicker than they were, but they did go through some of the ebbs and flows that we're seeing in this one, where things might look like they were ending, people opened up. I think that there was like a another case after they had opened up at one of the state fairs, if I remember my history correctly, and all of that with the Spanish flu. So do you think that we are maybe getting a little bit too comfortable and that we may not see another end, say, till 2029 or 2030?
Yeah, I mean, it's it's $1 million question, right? I have a lot of hope, and a lot of it stems from the fact that we have way better technology. We have ease of sharing information across the world. We also are making some pretty big headways. Now, the problem is we're not going to really be able to talk about this going away until the entire world is vaccinated. And that's the kicker, is we have to do a better job of vaccinating our countries that don't have access. Otherwise, there will always be a variant. Now, I think there's much hope here, but we're talking about a country that's over 50%, 55% fully vaccinated. That's promising. It's only been, a year and a half or so, right? So if we can keep progressing towards that herd immunity and find that community spread is lowered, that's going to take, of course, vaccinating the unvaccinated, but the body does what the body does, and after a while, it's going to become something as regular as the flu and the cold. It just needs time to run its course and do what it does. We're going to probably have COVID forever. I'm never going to negate that. It's impossible to think that we'll just no longer have COVID. That's always going to happen. But I think it will become endemic, meaning it'll just be pockets of places and times of year where it kicks up and it goes back to normal after. But it does start, of course, with vaccinating and providing more access to vaccines in countries that don't have it or aren't able to make it. We have to start with them. Of course, we got to take care of our people as well. But if we start seeing this as a worldly public pandemic, and start putting the money where our mouths are and putting them into places of need, that is when we'll be able to really start moving the needle. So that way, if we're stymieing the growth of viruses spreading in our worse off countries, so to speak, or countries that just don't have the access and money, low income, they're not worse off, excuse me. Um, we can at least curb spread if we know other places are vaccinated. So it's the same concept for our communities here. We know rural communities have higher rates of vaccination as well as those who are marginalized. So if we focus on helping with them, we can eventually curb all of this, and it will be hopefully a thing of the past, but that's going to take some time.
Yeah, it's going to take a minute and take some while, and people have to follow the rules and things of that nature. What do you say when people tell you, and I'm sure you get this as one of the discussions when you're talking to people out and about in the community, and they're like, Joe Blow or Sally Smooth or whatever got vaccinated, and then they came down with the virus and things along those lines. Because I'm sure that is one of the conversation points, because I know that I've had that even with friends and family in my own existence and life and everything. And they'll be like, yeah, that person got vaccinated. I want to say that they said that person that you're talking about, that is the one case in California, that they had been, I want to say, double vaccinated. So what is your reply when you hear of these cases, including some famous cases? I think there have been even some sports figures and some people in the entertainment field that were double vaccinated, and in some cases even had the booster and then still came down with the virus. So what is your response to those people that are skeptical for that exact reason?
Well, I see it as, we never said that these vaccines were 100% foolproof, right? Even when the best data came out with the very first strain of COVID with Moderna and Pfizer, we were talking 95%, 96, 94, whatever. And the key thing to note is that these vaccines prevent people from dying, and they prevent people from being put in the hospital, meaning you need a ventilator or you're severely in the ICU trying to recover and gasp for breath. That's the key thing to take away from here. We know that the vaccines, as great as they are, after you're doubly fully vaccinated, they have waning immunity after a couple of months. So just like your flu shot, no one gets a flu shot once and you don't get the flu ever again.
Yeah.
That's just what it is. So we have to keep in mind that these vaccines, as great as they are, and they are a godsend, they are not going to keep any and everybody from being 100% foolproof protected from this virus. And with that being said, there's also individual risk factors. Are the people that are getting it again, I guess, another COVID infection, are they, over 60 or 70? Do they have diabetes? Are they immunocompromised? Do they have other things going on that can actually increase the risk of them getting COVID? Do they have asthma? Do they have breathing issues? Are they a smoker? Are they overweight? So clinically, these all questions matter, and they are all higher risk factors for people getting it again, as well as being in older age. So again, we can't go off of what we see with that one person and assume, well, that happened, so why should I even bother? Everyone is different, and everyone's bodies respond differently to the vaccines. So we know scientifically that it does promote a strong immune response, but we've had patients who have had cancer and who are immunosuppressed, and they have gotten COVID. Even though we still encourage them to get the shot, we're reducing the chance of them dying and needing a ventilator. And that's really the bottom line when it comes to these vaccines. And no one wants to be in a ventilator during the holidays.
Oh, no, definitely don't want to be on a ventilator during the holidays whatsoever. That is not a pleasant thing to be dealing with whatsoever, and things along those lines. One of the things I was just wondering your thoughts about this. And this is away from the COVID discussion, but still dealing with medicine. My mom recently was in the hospital and everything. She had a fainting spell and things of that nature. They're still trying to figure out exactly what happened, but we did spend Thanksgiving with her, and she is doing quite well and all of that. But some of the care she got, I remember her having one of those care moments and everything where the nurse was basically trying to give her some food and everything, but she was feeling that, she had just had her pills and things of that nature. So even she knew that you were not supposed to be mixing the food and the care. So as she put it, she had one of those teaching moments with the nurse saying that, look, you don't need to be giving me this at this particular time. You can bring it back later on and everything of that nature. So I was just wondering, do you think that we're doing a good enough job of teaching basic medical care in general, or has COVID gotten us away from basic learning of how to even treat our patients? Because I know that the doctors have always, particularly under this time, been considered heroes. But I was just wondering, do you feel that there is the kind of home care training or the training with their patients that they should have?
That's something that's I feel is extremely important in healthcare. And you have to also understand that a lot of these providers who are still doing what they're doing have not only survived COVID, but they're also facing public doubt, public denigration, impatience with people. They're a little frustrated. They feel a little let down. And they are heroes that deserve to be commended. I feel providers at their heart still have the patient's need at the front of their care. So that includes having a good bedside manner, having, the empathy, having the communication skills to have a rapport with their patients. I think that's still there. And I feel as hard as this has been for them, that's not going to detract from why they got into medicine in the first place. Of course, we know that there's a great resignation. People are leaving their jobs left and right. That's across the board. So I don't think that our medical system is straying from that. I think it's just hurting in general. I think it's just going through a bit of revamping with huge demand for need and a lack of people to do it. So when you have more of a job put on less people, their jobs are harder. And so you have to come from a place of empathy for them, because they're still coming in working hundreds of hours, and the public still doesn't quite appreciate them. I'm not saying everyone, but I feel that there's still very much a desire to keep the patients at the forefront of their care, of their health and well-being. And yes, some people may be burned out, but a lot of times we put on a mask just to help our patients and go on to the next one without breaking down. So I have the utmost respect for what our systems are doing. Don't get me wrong. I know the healthcare system's broken. I know that there's flaws and discrimination and disparities. But I don't think we've lost our way as a society on how we address patient care.
No, I agree. I think the patient care, and like I said, that particular nurse did take it as a learning moment, did take it as a chance to learn what was going on and all of that. So I don't think that they were offended by the fact that my mom used that as, she called it, a teaching moment. So definitely had that teaching moment with them and let them know the way that she wanted to be cared for. So I actually wish that more patients would do that as well.
Yeah.
It's kind of like take that lead in their own care. And if they see something being done wrong, to point it out, but not point it out in a attacking way, but more in a kind of way, as showing what was done wrong, but not in a critical manner, in more of a teaching manner.
I agree. I like that. I think that's a good premise to have when you come to
I think that's a great premise to have, and I wish that more people took care of their medicine that way. You did bring up something that I did remember hearing about in the early days of the pandemic, which is that people felt that certain parts of their care were not getting as much attention as they would have liked, whether that was people that were dealing with diabetes, dealing with heart issues, dealing with cancer, because this was the elephant in the room. It was the one that everybody had their attention on. But I do know that there were some people that felt that some of the other issues that are still very much prevalent in our society, whether that's MS, whether that's leukemia, whether that's a number of other things, that they didn't get the kind of attention that they would have liked. Do you think that that is a fair criticism of people that are in those kind of ailments and everything of that nature? Because I do know it's a very important thing. We're in the middle of a pandemic, but I can also understand where people that are dealing with everything from prostate cancer to leukemia could have been like, hey, doing that whole kind of like, hey, I'm over here too, and I've got my issues as well.
Yeah, I mean, I think that's a fair assessment. Truthfully, a lot of our patients suffered and unnecessarily died because they neglected services that otherwise would have been treated had we not had a pandemic. And I think that's the key word is we're in a pandemic, so everyone's resources and hands on deck are going to trying to treat people dealing with these COVID symptoms. So unfortunately, that's led to practices turning away patients. It's led to people delaying, annual checkups and screenings and vital preventable measures. And so that's why, as a whole, we are seeing upticks in pretty much everything: depression, mental health, suicide, drug abuse. We're seeing diabetes conditions that could have been normally controlled. We're seeing literally upticks in every chronic condition you can name because of the lack of cohesiveness in how we've approached not just COVID, but just this entire pandemic. And so, with that being said, if you're putting all hands on deck to solve one thing and just barely staying afloat, we have healthcare systems losing money, losing funding. So they're laying off people because they can't afford to keep them in practice. It's a bigger problem than just the healthcare system. It's literally everyone right now when it comes to jobs, when it comes to employment. We're seeing this across the board. And so if we don't have a system that is a little more, not necessarily universal, but flexible to offset certain issues for others, we're going to keep seeing this. And this is what's been an issue at hand that only COVID has just shown a light to. It's been around. We know that we've been on the edge of really breaking as a healthcare system. And so we're seeing it now. We're seeing nursing homes have shortages. We're seeing assisted living facilities can't keep people and caregivers. So now care is hard to receive. And that again is a compounded issue. So it's unfortunate, but I think it speaks to the bigger problem of our infrastructure and how we deliver healthcare in this country.
And speaking of infrastructure, I did want to bring in Steve, who is he's the main host of the morning edition, and he's the one that kind of coined this phrase of it being a hydra. He's definitely brought it up a couple of times that it is a hydra, and every time he turns around, there is a new variant. And I did bring that up to Delon Canterbury and everything. So definitely
take my Santa hat on. I guess you can't be a host of a show with a Santa hat on.
I'm sure you can, but definitely.
But thank you, Delon. It's great to be here with you. And Mark, thank you. Just wanted to chime in here before my next meeting. But always great to be a part of the IBN TV, Pod TV family. But yeah, I think first of all, I think Delon hit it right on the nail. Just the infrastructure with healthcare and kind of just how hard it is, even in today's COVID pandemic, during this pandemic, to get supplies out, to get vaccines distributed in time. We've come a long way in the United States, but worldwide, only 50% of every continent in the world has been vaccinated. And we initially during the pandemic thought it was lack of access, but the United States of America is donating billions of dollars worth of vaccine almost free, and many countries aren't taking it. So there's still a lot of skepticism out there about the healthcare system, about government, about vaccines. And in the US, part of it's political, obviously polarization. Only 35% of Republicans are vaccinated versus, or 35% are not vaccinated, and only 10% of Democrats are not vaccinated. Part of it's also just skepticism of, well, I don't want to get vaccinated if I have to get a booster. You told me I didn't have to get a booster. I'm suffering from that myself, right? I got 2 vaccines, and now my wife's telling me I've got to get a booster, and I don't want to get a booster because I don't want to get sick. And I've got 18 Christmas parties as an elected official and a business guy, and now I'm going to knock a whole weekend out if I get sick, right? But the infrastructure is huge, guys. I mean, I think in the United States, costs are going up. More people are having a hard time affording healthcare, right? And drug prices are not going down, right? And so I don't know what the answer is. I think we've got to reform the healthcare system.
Yeah, I agree with you. And Delon, one of the things I was going to bring up, and I'd love to hear both of your thoughts about this, is we've also seen a real crisis in mental health, because a lot of our kids are definitely facing that as well. And I know that in the past, sometimes we would, give them certain things that we might want to put in terms of drugs that we say can deal with attention deficit disorder, whether that's Ritalin or whether that's a number of other things. But I was just wondering, what is your thoughts about the whole way that this whole pandemic is impacting our mental health, and particularly that mental health of our young people? Because I definitely know that I've seen several statistics where the whole way that it is impacting our young people is very detrimental.
Uh, it has been severely impacted, especially for our Black and Brown children who are dealing with uh, really a lack of schedule with certain situations, lack of consistent schooling, if they're able to go in person, lack of resources for counselors to deal with children. There is a spate of demand of children suffering with mental health. The screen is not working. We have evidence showing that. We have evidence showing that this disruption is going to greatly affect our labor force for years to come. And mental health, I'm glad, is becoming highlighted a bit more in the healthcare space. But the resources are still finite. We still have people who are working the streets, developing in programs for those dealing with substance abuse, loss of COVID, grief. And the teenagers, unfortunately, are taking a huge toll on this, as well as the fear of just not having any sense of normalcy. It's like they're growing up in a bubble, so to speak. And families unfortunately, are seeing domestic violence on the rise because of this, because they're forced to still be at home. They don't have someone to escape. So we're seeing ripple effects, not only from the educational system, but in our community levels of impact. And that's going to affect work. It's going to affect labor. That's going to affect, honestly, education. That's going to affect our health system. And so, on all ends, again, it comes back to infrastructure, and I feel better funding for those nonprofits, those community facing organizations that do the work already and have trusted relationships to just survive and keep the momentum going and addressing these needs. But it's an opioid epidemic, it's a pandemic of COVID, it's mental health, it's a number of issues at play here, and the children unfortunately are suffering terribly from this.
You
Yeah,
mentioned
yeah. Go ahead. Sorry, Dylan. Thank you.
No, you're good. One of the things that I'd love to hear your thoughts about this as well, but you mentioned it. We barely even talk about that epidemic, which is also an epidemic as well. So, what are we doing to fight that opiate epidemic, and I know that it's seen more as a white middle class kind of issue and everything, but we also saw that there was a parallel between the way that it was handled and the crack cocaine epidemic. But I'm just wondering, do you think that we're doing a good enough job of dealing with the various epidemics that are out there? Because I know that the pandemic is the main one, but there are other ones, and the opioid one is one that exists. So I was just wondering, do you feel that we're doing enough of a job in even addressing that issue?
So I'm seeing a shift in some of the prescribing habits when it comes to opioids. I'm not hearing and seeing as many providers just willing to throw an oxycodone at somebody. So I think there is an understanding of the need to address this. I mean, even since our last president made an initiative to try to tackle the opioid epidemic a couple of years ago, we can't negate the fact that with this pandemic, people's mental health are through the crapper. And so that leads to alcoholism, abuse, and other issues that relate to the result of drug abuse. So in terms of what's a good job is kind of relative depending on where we are. In Durham County alone, this is the only county in North Carolina where the majority of overdoses are in African Americans versus their white counterparts. It's the only county in all of North Carolina that has more ODs for Black people than whites, with whites still being the majority in Durham. So that leads to the question of what is happening on the ground roots? What is the infrastructure, again, like Steve mentioned, and where's the funding to combat this? If we're dealing with the pandemic of COVID and of drug abuse, where do the resources go? And how do we tackle all and see that this is a community issue and not just a one-off? So are
Yes,
we
and in
good?
terms, yeah,
I think it's more to come. We still are dealing with it. It's on the rise. So it's an uphill battle, but I have hope
and
again with
and
everything.
and I'll give you an example. I'm a very there's a lot of when you talk about mental health, a lot of bullying, cyberbullying. I have a family relative that's being bullied right now in the school through the internet, through social media. Now, I went through a very, very, very negative, brutal political campaign and came out winning very big. But I must say that the toll on my mental health was more significant than I had imagined. And I cannot even imagine. I'll give you a couple of examples. Anonymous emails and posts coming, attacking me, attacking my character, lies, untruths that are said that you have to see every morning. And I'm not talking one time a day, two times a day, 14 times a day. Messages every hour from the time that I got up in the morning till I went to bed at night on my messenger, on my device. Reading that negativity every day affects your mind. Imagine what that would do to a
Mhm.
kid, right? Now, I don't have a drug problem or drinking problem, but what's interesting is after the campaign, for the first time in 9 years, I'm drinking in the evenings because I still feel a letdown that human nature could be so negative, right? And I'm not saying that I have a drinking problem, but the fact that I, who doesn't even touch alcohol, feels like I need the drink now,
Mhm.
and it was 3 nights in a row, guys, right?
Mhm.
Now, where I'm going with this is imagine somebody that's under pressure, somebody that's lost their job. They want a quick fix, right? So I'm purposely going to have a ginger ale tonight with cranberry juice because I want to prove to myself that I don't need to turn to the Jim Beam honey bourbon at home because it tastes good, but it makes you relax. But it's an easy escape. And I think that I did suffer some mental damage from this last campaign, and I might need to go seek some therapy because it hurt my self esteem. And I don't know why it was so hard. And I think because it was happening in a time when I wasn't around people a lot, because I'm working from home. So I wasn't able to feed off the energy of others to forget about it. So I go right back in the campaign or I come home. Right. So imagine what it's like for a kid in school. They get that bullying, they come home, they got to go do their homework. Right. And I'm telling you, the suicide rates are up. Technology, people are using it a lot, and I think that that's a huge part of mental illness: the confusion, the fear, and you feel a bit lost, right?
Yeah, I
Um,
definitely agree. Hey,
yeah.
Delon, he actually brings up an interesting point, which is, I know you're more on the pharmacy side, but do you think that we in our Black and Brown communities are still having issues with therapy? I know that I've got some friends that are in therapy and they are very close to their therapist, but I know a lot of others that you couldn't get them into a therapist if you tried, and that's because of their fears of therapy and their fears of dealing with therapy. And and I agree with what Chief says, because a lot of things are going on that probably were forcing many of us to need a therapy because of the way we're even changing our job structure. I know that there's a lot of small businesses that can't even find people to work because those people want to work in home and want to work remotely. So they might be getting government money or they're waiting for that remote job because the remote job is in their house. They're not trying to work around people because of the partially the fear of the pandemic and partially just wanting to make a little bit better money that they feel that they may get from the remote work. But I'm just wondering your thoughts both about the remote work and how it might be impacting our mental health, and also this notion that many of us are afraid of therapy.
All that long ago, but I definitely think remote work does affect mental health.
Oh, for sure. Definitely affects mine. I work from home, but yeah, I think yes to both. And it's also historic, cultural. I think we have some misgivings and hesitancy, just like some those had with the vaccines when it comes to therapy. But I'm a huge proponent of the need of discussing it and the need of unpacking ourselves to really have a nice lens of what we are doing and what we've honestly taken away from our upbringing, from our environment. And so I think that the resources are there. I still think we are seeing a little bit more on social media, some people talking about therapy openly, and we have celebrities openly talking about it. So I don't think it's necessarily out the window. And I do find myself seeing minority influences and people who have viral followings talking more about it. So it's not out the realm of possibility. I do feel you maybe have some barriers with some of our older patients who may not be as willing to change that mindset or their points of views. But I have full hope and belief in therapy. But again, that comes down to access. That's still a resource. Not everyone can afford therapy. Not everyone uh, has the time. Not everyone has the flexibility to stop what they're doing and raising their family to go to it. So some people have therapy through other family members and just talking, but I think having a licensed counselor can truly help and help us become better people. So I'm a huge fan.
Yeah,
Yeah.
Delon, just out of curiosity, and I've actually got a upstairs neighbor that is studying psychology here at Duke University and everything, and they are of the minority backgrounds as well. But do you think that we are seeing enough of us going into pharmacy and or the medical fields in general? And if not, what can we do to get more people in those fields? Or do you think that there's our fields? Because historically speaking, people would tell you they want to be a doctor, a lawyer, a policeman, and some of these other kinds of careers, even teachers back in the day and everything. But I'm not sure, even though they are now seen as definitely heroes, and definitely the pandemic has brought them in that hero light. Do you think that it has pushed more people to look at those careers, or do you think that we're still seeing a shortage of us, meaning Black and brown people, in pharmacy fields and in medicine in general?
Yeah, I mean, historically, that's been the case for decades. Unfortunately, what at least from my profession in pharmacy, 7% are of African American descent, of which 4% are male African Americans. So even in my class, it was 10 out of 132 pharmacy students from UNC. So this is always going to be there. Does that mean we're not as interested or capable? Not at all. Some of it, again, is access. Some of it is the feeling of you need to spend X, Y, Z to get to that level. And sometimes they're not even having the exposure or role models of people to show them that there is a way to this path. So again, it's still a bigger picture of what are they being exposed to? What are they learning? What are they being, influenced by? Is it a desire that they truly want? So there's always going to be a need. Is there a lack? I mean, yeah, there's always been a lack. There's even a lack of doctors and pharmacists, period. Like, that's just what it is. So if there's a lack in one thing, there generally will be a lack of minorities in that very same thing, right? So I have hope, but
Yes.
it's still a problematic
And
thing.
yeah, exactly. And during the pandemic, we don't often talk a lot about immigration, but immigrants played a huge role in serving as frontline workers during this pandemic. And we need to thank them for giving a lot of time, particularly in the big cities like New York City, Chicago. You have a lot of frontline workers that are minorities that are from other countries. So I think that, but getting more of the people to go into medicine, to go into, nursing, physician's assistants. These are the jobs of the future, very, very well paying. And we need more of them coming out of this pandemic, because I don't know, if this thing's going away anytime soon.
Okay, that's what we talked about earlier, and that's one of the things Delon was saying, that it might be a while and everything. But I do have a question that has come up on some shows that I've been part of, both here on the network and even on LinkedIn and other places that I hang out at. And I was wondering, are you worried at all, Delon, about this kind of new technology that we're going into, where a lot of people are looking at the metaverse and looking at kind of these hybrid worlds and things of that nature? So do you have any fear that at some point we may actually not need a physical pharmacist, that we'll be able to get to that person doing it via a robot or via some other form of AR or VR? Does this worry you at all in terms of the future of pharmacy and the future of medicine? Because I've heard some people that are, wondering whether these are jobs that will be eventually eliminated by some of the high-tech stuff that we are looking at as we move into a more technological world.
Yeah, it is a concern for me. And I can only really speak as a pharmacist, but
Right.
that's the future of where everyone's going, is automation and advanced technology. I think I'm even seeing articles about restaurants that are only run by robotic arms. And I can speak to what's going on now. I mean, they're closing pharmacies left and right. They're downsizing. They're getting into digital spaces. They are also piloting ways to basically do away with the need of a pharmacist. So it's not like it hasn't been talked about. It's still a very much a risk. Now, you know, Whether that's going to be all bad and doom and gloom, I don't know. I know it's going to reduce the need for a pharmacist, so that can lower wages and, of course, make it harder for students who are finishing up with tons of debt. But you're still going to need them in some way, shape, or form. Even though we're shipping to the Amazon pharmacy and mail order, you still need a pharmacist. It may be at a lower wage, but it still comes to what is that person doing to basically excel themselves and separate themselves from other fields so that they can be their own boss, their own entrepreneur, and have that type of lifestyle they want to seek after.
No, I definitely agree.
Mark, I'm sorry to step off before I leave, but you asked a question about technology.
I did.
Yeah, I think that technology is the game changer, right? I mean, I think that we have technologies today that, if you think of the one good thing about this pandemic, was it pushed the messenger RNA technology for vaccines, which is almost like your body sending an email to develop the proteins that to fight the virus. And this kind of research and development could be a game changer in terms of finding cures for cancer and things like that, right? Genomics is going to be the big industry of the future. And so they've taken biotechnology and married it to technology. And so we can map and predict through data and analytics, even using tools like artificial intelligence, where we might even be able to better predict based on history of when you might get cancer, if you might get cancer, what are the odds of getting cancer, right? My father, who's 81, uses the Fitbit now. He sleeps with it to track his REM sleep, his heart rate. The joke is that it's got him so stressed about what his heart rate is when he gets up that now he's having a hard time sleeping. So my mother wants to take away the Fitbit. We were teasing him the other day. But the point is, the technology can be used to track our health in real time, right? Where we didn't have these technologies in the past. Hopefully, we can use these technologies productively to deal with future pandemics, to make sure that we're better prepared. The final component is tracing, contact tracing, making sure that we do a better job of isolating people once they're infected before they go out in the public, which we don't really talk a lot about, but that's what other countries are doing a better job of the US, right? Because you can get a COVID test, but while you're waiting for your results, you might be going out there and infecting someone. So having more rapid testing where you get the testing and you find that you have COVID, then you're quarantined automatically for 10 days, and then you're let back out into society. We could probably prevent a lot of spread that way.
I agree with you. Speaking of stress, I know that there's another organization that Mr. Canterbury is very much associated with, because that's actually how I met him, through that person that is part of that organization. So I was wondering if you could talk a little bit about the importance of the arts to dealing with our stress as well, because I do know that you are friends with the people that are part of the African American Dance Ensemble and things of that nature. So I do know that that is a passion project of yours as well. And we not only have the test coming up that you're going to be part of on the 4th, but the Kwanzaa celebrations are going to come up as well. So I'd love to hear your thoughts about just the importance of arts to our mental health and to life in general.
Yeah, man. I mean, I love the arts. Definitely trying to support local artists here, and seeing it and working with Dr. Birch, who leads that ensemble. We have to mix a little bit of fun with what we're doing, and it gets us grounded. It gets us to who we are. It preserves our culture. It preserves our history, and I have seen that honestly drive certain outreach events when it comes to clinics and COVID events. So frankly, it's necessary, and we can't always think everything is doom and gloom. So I'm a huge fan of incorporating the two and bringing that energy to people so they can, feel refreshed and have just a moment of peace and not the usual stuff on the news. And myself, I enjoy playing the cello. I'm a huge fan of just playing the cello and trying to relax that way. But we can't forget where we came from. And I think that's a part of being expressive and part of being human is having that side, energized and activated.
So I'm trying to picture you playing the cello while you're handing out the pharmaceutical pills. And I was wondering if you ever have those moments where you're actually trying to do a performance and also hand out some of the pharmaceutical items that people need or have you avoided that moment so far?
Yeah, not that yet, not that yet, but that'll be a sight to see.
That would be a sight to see. I can see you trying to play the cello and doing that. At what point, and I may have asked you this the last time that you were on, but at what point did you realize that you wanted to go into pharmacy and that this is a field that you realized that you wanted to be part of?
My parents actually come from Guyana, South America, and so we use a lot of herbal products, natural products, and that really was what inspired me to look about at medicine differently, look into healing and using that knowledge base to serve
Yeah.
others. So I loved natural plants, and that got me into research. That got me into antimicrobial research, and put me in the space of treating people with the expertise I have in medication management and
Delon, were you on
prescribing.
get
So
were you on get with
that's
the
been
program?
my incentive, and I
Were you
loved it
on
ever
get with the
since. And that's
program?
how I serve.
Were you on get with the program with Gary Jones?
Yeah, I was.
Oh, yeah, I heard that show. I'm a
Oh
commentator
yeah.
on his station as well. I heard it while I was running. So I knew
Oh
I heard the
nice. Yeah.
I didn't mean to interrupt. I knew that
Gary's
Like,
actually going to be at the event on Saturday. He's going to come through and highlight some of the work we're doing at our over-the-counter flu COVID event on Saturday. So,
could you
yeah.
that's
yeah, could you send some information about that? I'll promote that in my next newsletter.
Oh, for sure, man. I'd love to. Yeah, what's a good email for you? And I'll be happy to do that.
SR@steverao.com. It's easy.
Yeah, that would be a great email and everything. Hey, Delon, do you ever, because I know there's a lot of people here in this area that are big fans. I'm actually a big fan to some degree of holistic medicine. So even though you are in that pharmacy field, your family is actually was very much from that holistic background. So are there ever any times that you actually encourage people to look at holistic medicine and actually encourage them to look at, say, some of the natural cures that are out there? Because I sometimes feel that um, in a lot of fields, not necessarily this pandemic, because I don't know that we found anything that is a natural cure for it. But I do think that there are some things that have natural cures that we don't pay enough attention to. And with your background, even though you're a pharmacist, I was wondering if you ever allow yourself the privilege or the ability to not just tell people about what the more go-to kind of medicine is, whether that's a cold peel or something like that, or something that might be more in the natural holistic field.
Yeah, sometimes there are, and that might be a whole another long conversation, but I don't think all natural products are bad. Some do have their risks, some do have strong drug interactions that people need to know about. And we wrongfully assume that all things natural are safe. But there is really good evidence for certain products. I'm a huge fan of beetroot juice to help naturally lower your blood pressure. I'm a huge fan of fish oils for helping with basically heart attack prevention and lowering your triglycerides. That's a natural way to do that. Red yeast rice also is a way to lower cholesterol. They have cinnamon extract, which can help with weight loss and metabolism. So the problem is, it isn't that the science is bad, it's that the manufacturers don't always put what they say is on the bottle. So you have to have discretion in what you're taking, because unfortunately you don't know.
He disappeared. I was hoping he was going to come back. He disappeared. Hopefully he'll come back and rejoin us, Steve, and everything, because I do agree. A lot of times we don't know all of those different things. As a matter of fact, I just had a conversation. Oh, here he is, and I'll bring him back. Yeah, you bounced off there for a second and everything, but you were talking about how a lot of times you don't always know what's in them. And the story I was going to share with Steve, and it kind of comes back to what you were talking about, Delon, is that my brother is facing a medical issue and everything in terms of certain things that he's got to deal with and all of that. But he was looking at, I think he was going to a department store, maybe it was a store, and there was somebody that was trying to sell one of those, I call them cure all kind of pills that claims that it can cure everything from cancer to MS to leukemia to whatever else might be out there. And we all know that there is, even though historically, even back in the cowboy days, they were snake oil salesmen, but there is nothing that can cure everything. But there are people out there that are still trying to sell these as the cure-all. So that's the ones that really worry me, is these folks that are trying to sell these cure-all kind of pills. Then I don't know of any pill that is a cure-all, whether it's a one that is you get from the pharmacy or whether it's one that you get from these holistic folks as well. But I do know that there are folks that will be like, oh yeah, take this red pill, it'll cure everything, or take this root, it'll cure everything. And I can't think of anything that's going to do that or anything that's been invented that way. But maybe you've heard of something that I have not heard of.
Hey, well, Mark, I got
Nah.
to leave. I've got to head to Raleigh, but I want to thank you for letting me come on your dinner
Oh
party.
yeah,
Really appreciate it. And Delon, it's an honor to meet you, sir.
Yeah,
Um,
man. Was it sr@steverao.com?
yeah,
All
that's
right,
it.
cool. I'll email you. No problem.
I didn't mean to interrupt. I'm sorry. Look, coffee was a little too strong this afternoon, but
No problem.
um,
I appreciate
but
it.
Delon, thank you. And I love Mark Lee's such a great friend, and he's a great media guy, and we're all part of the same family here. So thank you so much.
Yeah,
Absolutely. Thanks.
See you tomorrow morning,
no
Mark.
problem.
Thanks.
Thanks. No problem. Appreciate you, Steve. But what do you say to that, Delon? Those that are trying to sell those, for lack of a better term, like I said, they're snake oils, basically is what they amount to, and everything.
Yeah, don't fall for everything you see out there. That it's a little tricky. Make sure you're talking with your provider and your local pharmacist on some things you may have heard. Um, it's kind of easy to get caught away with the stuff you see on the internet, and Dr. Google is heavily relied on. So try to get your facts from someone who doesn't have any incentive to sell you something. I think that's the first principle you want to take on. But nothing is going to be able to treat everything. That's just nonsense. And again, you want to just kind of check your facts and make sure you're just not buying something else that's not going to really help you. But it doesn't mean that everything you do needs to be Western medicine. So it's kind of a balancing act of you know good data, good information, a trusted resource. Uh, but hey, it's not impossible. So we're quick to lose track of that. So don't fall prey to the nonsense.
No, I agree. What is one of the things that you wish more people would ask their pharmacists when they come in to get their pills and everything? And by the way, Robin, we call her Robin Joy, but Robin Cooper says that she was going to say hello and that she knows you and everything because she actually has a show here that airs on Wednesdays at 8. And she was saying, Delon, and was saying that you are a good friend of her son. So she was saying small world and all of that. So definitely she was saying and giving you hellos as well.
Sorry, I cut out a little bit. What'd you say?
I was just saying that Robin was saying hello to you, Robin Cooper, who is apparently a good friend of you are a good friend of her son, and she does a show here on this platform as well. She'll actually do it later on this evening.
Oh, cool. I did not know that. That's amazing. What's going on, Robin?
And then the question I was asking you is, what advice do you wish that you would give to people in the terms of that people would give when they go to their pharmacist? Because a lot of times I think people go to their pharmacist and they don't always ask the correct question. So what are the questions that you wish more people would actually ask of their pharmacist? And by the way, Robin was saying that AJ is her son.
I figured it out. I was like, yeah, it's one of my best buddies. Yeah, I was just at her house not too long ago, enjoying some good food, I think, for the 4th. So yeah, I say to ask everything. I think that's something that we get kind of scared to do. It's a little harder now with COVID, but I don't think patients speak up enough sometimes, or they don't think that it's their place to. So you got to understand you're the CEO of your own health. So you have to put all your questions on the table, no matter how dumb you think they may sound or convoluted. Ask everything about those meds. If it's a new medication, is it going to interact? What are the side effects? When can I stop the medication? That's probably the number one question I want people to start asking is, when can I stop the medication? I think we focus on once you take one, you're on it forever. And so one of my prides of my company, Geriatrics, is literally teaching people how to stop medications and how to work with their doctor on ways to do that safely. So I think learning how to stop meds, and if you feel someone is over medicated, you probably are right. So are you asking those probing questions on behalf of you or your loved one? So that's the main question that I like to ask, because I think we like to throw medicines at people and don't always wonder what the timeline is and when to stop.
Because Robin actually, one of her shows that she did, I want to say a month ago, dealt with autism and people that are on the spectrum and things along that line. And that is one of those cases where I do think that sometimes we over medicate and are too quick
Mhm.
to get people into these kind of medicines that are what I think most kids are anyway, which is kind of hyper. And I'm not saying that there are not people that don't need those kind of medications. And I'm just using Ritalin as one example. I know there are other ones out there that are similar, but I do think that we sometimes over medicate our kids for basically being kids. And I also think that we over medicate our older people sometimes for being their age and everything. So, because I definitely, and I did love the title of your company, but I do sometimes wonder if we don't feel that because folks are getting older, and I know that I'm getting ready to hit 60 next year, and mom is definitely into that 80, well, about to hit the 80 range, and dad's already there. Then once you get to a certain age, it's kind of like, well, you got a sour leg or you've got a little burn in your hip and everything. Let's give you this or that and everything. And sometimes it can be something as simple as aspirin, because I sometimes think we might even over prescribe medicines. But is that a little bit too pessimistic on my side, or would you agree with me?
Sorry, it cut out for me. I only heard the last part about aspirin.
I was saying, do you think that we sometimes over medicate people, and aspirin can be an example of that, whether it's
Oh
Ritalin with
yeah.
our young people or
Mhm.
things to alleviate back pains with our older citizens?
Oh, absolutely. I've seen, unfortunately, aspirin overdoses
Wow,
um,
aspirin over.
for
Think Delon is breaking up, but I think he was saying that he has seen aspirin overdoses. I know that he did say his
now.
run out.
I
And
generally believe that we are over medicated.
you said you do believe that we are over medicated?
Absolutely, and unfortunately, but fortunately, that's why I started my company, Geriatrics. .org. We literally focus on stopping over medicating in senior patients. So I've seen Benadryl be a culprit to someone being forced into a nursing home. I've seen aspirin send someone to the hospital because it was used in too high of doses. I think generally we are over medicated, and it's not just opioids. It's taking 5 and 6 blood pressure medications or 5 and 6 diabetes drugs. So this is one of my missions with geriatrics is to teach providers and caregivers how they can get their loved ones off of meds and save some money in the process.
So I'm guessing those companies that are very popular here in North Carolina are not the biggest fans of Delon, because I know that there are a lot of big farm companies that are right here in North Carolina, and we have a very big presence of big farm here. Glaxo Klein is here, and there are a couple of others that are here as well, including Pfizer. So I'm thinking that they
Mhm.
were probably, in that sense, not the biggest fan of you, because that's where they make their money at, and they are one of the top lobbies in the country. And I think that they are one of the top lobbies because they are trying to keep themselves protected as a business. So I understand it from a business standpoint, but I agree with you that I wish that they would prescribe less of those, even though that might cut into their profit rates.
Absolutely. Absolutely. Yeah, they don't want to hear from me, but that's the cross I'll die on. I have no problem doing it.
And that's a good thing. I love a man that is full of his principles and everything along those lines. Do you think that you see enough of that in the medical field? Because I do sometimes feel that some of our doctors and some of I would even argue our pharmacists are don't have that kind of integrity. And that's one thing I love about you. And I've heard you've been on my show a couple of times, and I've heard you on others as well. And one of the things I love about you is that you are a man of integrity, and that's something I wish that we had more of in certain fields. So do you think that that's something that we need to have more people be willing to stand on that principles and stand on integrity? Mr. Canterbury, did his mic run out on me again? I think his mic may have run out on me again, so we're going to see if he can get that situated. But in the meantime, I'm going to bring up one of the commercials that we've got as well.
Mm.
Delon, Are you able to hear me? Delon is still making an
Yeah,
adjustment.
man. There's
You
a
know what I'm
long name.
saying?
Some people, some practitioners, some providers, they do think this way. They do feel patients are over medicated. I feel the majority of pharmacists believe that. They just feel trapped because that's the way our system is designed to basically treat. You go to med school, they are literally trained to diagnose and treat. You go to pharmacy school, you're trained to understand the drugs and manage the meds. And so we're not quick to always question whether it's always appropriate, even though we're pharmacists. We want to, but you still have to cross that bridge and see if your provider agrees. If they don't, then you just, you fight next time. But as a whole, I don't think we do this enough. And that's why I have
Yeah, I definitely agree with you that as a whole, more people are doing the positive kind of work in that regards and everything. Like I said, I do know that not sure if the Wi-Fi is having its issues, but I do want to at least give you a chance to talk about the event again on the 4th and everything. But in the meantime, I'm gonna bring up about the Lawyers Den, which is now running, I want to say, on a daily basis, and then we'll be back with a little bit more conversation as well. And definitely, I want you to get a chance to talk about that event coming up. But now let's check out a little bit about the Lawyers Den, which, like I said, I think this was when it was running just one day of the week, but it is now running every day of the week at 7 o'clock. And they've been having some very interesting discussions. I'm sure they'll be discussing about that new abortion law that is on the table right now and all of that. And that should be coming up on this evening. But let's check out a little bit about the Lawyers Den.
It's time for you to start bossing in social media. For all your social media needs, you've come to the right place at the right time to get your website designed, landing page, social media platforms, and get the training you need to get in front of the people that's ready to buy your products and services. Let me train you with StreamYard, Zoom, Clubhouse, and much more. And let me help you get your virtual professionals, not assistants, because assistants can only assist you, but the virtual professionals can give you that professional flavor that you need to expand your reach and increase your revenue. Jump on in and get in where you fit in and start boxing today.
Yes, and Miss Lotus does some amazing things. She was actually helping with the Black Business Olympics, the Black Business Expo on the week before Thanksgiving. So that wasn't last week, but the week before that. And of course, she now has a show that she's airing here as well. And of course, her friend Barbara H. Smith had the amazing Holly Miller on. Holly Bird Miller on yesterday talking about makeup and things along those lines. So 2 amazing shows that are part of the network and all of that. Delon, if you're still there and everything, if you could tell people once again about that event, because I do know that the internet has a moment of its own. I do understand the powers of the internet. We even had an internet moment during the Black Business Expo because Spectrum decided to go on strike. So we do know that sometimes that can happen because it just decided to take everything down. And I remember getting a call from both Australia because of the network and from folks associated with the expo when that was going on. So we do know the internet has its moments and its time, even though it does allow us to have some great conversations and all of that. So Delon, if you're still there, I'm sure people would love to hear one more time about this amazing event on the 4th, which is in 3 days. Delon's internet may not be there, so I'm going to see if I can't find the letter that he sent and be able to share with y'all a little bit about this event going on from my standpoint and all of that. So he did send an email, and I'll see if we can't bring up everything that is going on. So definitely it'll be taking place from 9 to 2 in Durham on the 4th at Fisher Memorial United Memorial Church of America. And it's got a lot of great partners, included AM Better, North Carolina Med Assist, UNC, and Duke. That's right, they can get along and team up on events together and all of that. And several community members, and they're going to be giving away, like I said, definitely the COVID shot as well as prescription medicine giveaway for patients. And of course, there's going to be some food items that people can go for as well. So it is a truly amazing community event, and of course, very much a looking forward to seeing what happens in that regards. And there'll be even some over-the-counter medicine as well that folks can get also. And if you want to request specific medications, you can pre-order online by going to www.medassist.org/mobile and pick up your order during the event. So you can also pick up items for a friend or a family member. And y'all will be glad to know that no appointment or pre-registration is required. If you do not pre-register, you can come by and pick up a pre-packaged bag of medication while supplies last. And the event is open to everyone. All North Carolina residents are welcome. No income requirements to receive products, and no ID is required. But you must be 18 years or older, and this event is rain or shine. So it looks like it's going to be a great event, and it does look like they have some of this information in Spanish as well. So hopefully some of our Spanish brothers and sisters will be coming to this event and all of that. And by the way, Fisher Memorial United Holy Church of America is located at 420 East Piedmont Avenue in Durham. So it's not that far away from either North Carolina Central University or Hayti Heritage Center, if I am remembering my directions and all of that correctly. So it is definitely very convenient to folks that know those kind of areas here in Durham, North Carolina. So definitely, hopefully folks will be able to make it to this amazing event and check it out. It should be a great event, and one that more and more people should be attending, and definitely one that I am definitely going to try to make it to as well. So I'm going to try to make it to that event and look forward to seeing folks there. And they're going to be giving not just the COVID-19 vaccines, but it looks like they're also going to be giving away free flu vaccines as well. So definitely there's even a chance to win some food items as well. And definitely Don did mention that earlier also. So definitely that is going to be a truly amazing event, and I am looking forward to being at that event myself. So I'm not sure if Delon is still there. Delon, are you still there? Delon's internet is still having a moment and all of that. So he might be trying to get that fixed and everything. So I will take him off for a second while I bring up some of the LinkedIn news items, and hopefully he'll come back in the near future and share any final thoughts that he wants to share in that regards and all of that. I do know that there was another guest that said that they might be appearing at 6 as well. So I need to see if they are en route and if they're going to be coming here as well, because definitely try to bring in all kinds of news stories and all of that. And by the way, apparently Amazon had a record-breaking weekend. So that is something that I was maybe somewhat expecting, but not totally. So despite many retailers experiencing a lackluster Black Friday and Cyber Monday, Amazon says its sales hit record highs over the heavily discounted weekend. The e-commerce giant hasn't shared specific sales figures for what is typically its biggest rush during the holiday season, but said that some of this year's top-selling items include the Apple AirPods, Fire TV sticks, and Alexa gadgets. On Black Friday alone, Amazon secured 17% of sales, according to the numerator data, more than any other retailer. So looks like Amazon once again has done quite well in terms of getting those sales and all of that. Lisa Cuffey, the head of business development for Access Points NA at Amazon, said, excited to be part of Amazon Hub, where we create partnerships with enterprises and SMBs to host lockers and counters, delivering packages to customers where and when they want. Life just got easier. Amazon delivered over 10 million items to alternative delivery locations in countries around the world this holiday season, such as Amazon Locker or counter locations, including Amazon physical retail stores like Amazon 4-Star and Amazon Books. I need to find out from Nick if that's where he got David K. Johnson's book from, was off of Amazon. And if he did, he should have ordered it on my page, because apparently I am an Amazon influencer, even though I have not found any way as of yet to learn how to work that kind of benefit and all of that. So I'm gonna have to figure out how to work that particular benefit or thing that I've got going on and how to make it work in my favor. So that is something that more and more people are trying to figure out on a regular basis. So does look like Delon has left the building. So I was glad to have him on, an amazing conversation, and definitely glad that he was able to share a lot of things that he had going on in his world as well. So definitely glad that he was able to do that. And like I said, who knows, depending on what's going on with the internet, he may pop back on and all of that. But I'm glad that we were able to share a little bit of knowledge about the things that he's got going on and what is going on with this amazing event that he has coming up in the very near future, as in 3 days from now. By the way, there was a female promotions boom in 2021. That's right, women's careers took a severe pandemic-fueled hit in 2020, but this year we are seeing signs of recovery. Female internal promotion rates have increased by 11.4%. Male promotion rates increased by only 4.5%, according to the analysis of LinkedIn data. This is due to many factors coming together: an increase in attention on diversity, equity, and inclusion, the rise of flexible workplaces, and the traits of successful leaders shifting since this particular crisis, the pandemic crisis, began. So definitely Caroline Fairchild, a journalist for LinkedIn News, said some good news to share for working women. So far this year, female internal promotion rates have increased by 11.4%. Male promotion rates increased by only 4.5%, according to an analysis of LinkedIn data. This comes after the internal promotion rates for women in the U.S. dropped 8.2% in 2020 compared to 6.5% for a man. Sources told this particular lady, Ms. Fairchild, that this could be due to many factors coming together: an increase in attention on diversity, equity, and inclusion, like I just said, and that definitely is going to be an interesting thing in that regards. That doesn't mean the challenges don't remain, because apparently 7.1 million U.S. women that left the labor force during COVID still haven't returned. Biases against working mothers may have been exacerbated during the pandemic, and there is evidence that women are less willing to ask for a promotion at this particular time in the nation and the world's history and all of that. So that is definitely some interesting statistics, and I'd love to hear from our listeners how they are doing in the workforce and all of that. As a matter of fact, Ashley W. Boggs, who is a chief visionary person and everything, says she always looks forward to seeing about these things that are going on in the world and how LinkedIn reports them. And she is considered returning to the workforce and have faced all of the challenges that were mentioned. Despite their 20-year experience and education, the struggle is real, and knowing that I am the only one that has been severely affected, as well as knowing changes are happening, is encouraging and gives her hope. She is glad that the employee status as a stakeholder was elevated by COVID, and that especially working parents are given the support they need to remain and thrive in the workforce. So that is good news in that regards. Definitely glad to see that they are working in thriving in the workforce and all of that. So it'll be very interesting to see what happens in that regards and how things go in that whole situation in terms of more women facing these kind of threats on their work environments and their working jobs and all that. But it does look like there's some good news in that regards as well. So if y'all are watching and y'all are interested in sharing your thoughts on this, I would love to hear from you on the workforce and how you were doing in the workforce and all of that. So definitely do let me know, and I'd love to hear your thoughts in that regards. By the way, professional degrees in fields such as veterinary medicine, chiropractic medicine, and dentistry are leaving students with more debt than earning 2 years after graduating. A Wall Street Journal analysis found that those degrees are more expensive in terms of debt than those in master's and bachelor's programs. The costliness has driven specialists to cities where they can expect to earn more and resulted in a talent drain from rural areas. Law degrees, too, can come with a high debt to earning ratio, a separate survey showed. And I wonder what Nick Palveda and the folks from the Lawyers Den have to say about that as well, because definitely there are certain fields that are definitely in that kind of idea and all of that. And by the way, Ron DePinho, a professor and past president of the MD Anderson Cancer Center, said that African American students are taking on more debt and get fewer slots on grants, and it's up to us who do not suffer racial oppression to take a risk, make noise, and share. So it's good to see when allies are bringing up points as well. So definitely, and one of the other articles that was brought up was Terry Peace, who is a certified financial coach at TKB Financial Coaching and Partner Administration, said 136 billion with a B. That's the amount of private student loan debt in the U.S., up 47% since 2014 to the highest amount on record. Student loan debt is one of the expenses that is crushing some of the people that they work with as a financial coach. And what they find interesting is that many people view this as a necessary burden, signing up for a 10-year, 15-year, or more repayment plan and just accepting that as a fate. Their idea is to throw every extra penny available at this debt so that it's not a burden for 10 years and you can get on with your life and do all the great things you want to do. It's definitely a countercultural idea, not to seek the lowest payment, but to make the highest payments possible to get rid of the debt. So that is one of the things that particular person was bringing up and all of that. So I'm also seeing that tech finders are leaving their jobs. So I'll have to find out about that article in a second, that is. Salesforce has a new co-CEO. That's right, Bret Taylor has been promoted from president to co-CEO of Salesforce and will lead the company alongside co-founder Mark Benioff. Taylor, who joined the tech giant in 2016 when it acquired his productivity startup Quip, previously held high-level positions at Google and Facebook. A longtime Twitter board member, Taylor was also named chairman of the social media platform following Jack Dorsey's resignation. Salesforce reported strong third quarter earnings, but mixed guidance on Tuesdays, and shares fell in response. And one of the things John Fort, who is a CNBC anchor, said that entrepreneurs often start early. Bret Taylor was named co-CEO of Salesforce today in this, and definitely it'll be interesting. As a matter of fact, I might need to try to get him on one of our shows and all of that. And by the way, Salesforce has expanded massively in recent years, and steering that ever-evolving ship is a heavy burden for one person. So looks like there's going to be a teamwork going on in that regards as well. By sharing the burden, Benioff has more time to focus on strategy and on his political and philanthropic initiatives. So one of the things that was said is that Bret is incredibly competent, very influential, and most importantly, a visionary. Bret co-created Google Maps in 2005, led Facebook's tech as CTO for 3 years, created Quip in 2012, selling it to Salesforce in 2016, and is credited with doing the groundwork on the $227.7 billion Slack acquisition. Bret also played a central role in forming the Customer 360 strategy. Bret's role is and always has been to consolidate the, at times, nebulous offerings from Salesforce. Additionally, as independent board chairman at Twitter, and with Jack Dorsey stepping down, It definitely looks like Brett is poised to make a lot of waves. So it'll be interesting to see how this teamwork works and what happens in that regards as well. I did say I was going to find out a little bit about this article that had to do with tech finders and all of that. So I'm going to bring that up and see what's going on with our tech finders before bringing up some other ads from some of our other shows that exist here on the network. Tech founders are finding the exits. That's right. Jack Dorsey's abrupt departure from Twitter to focus on Square, which is now renamed Block, is the latest tech leadership shakeup involving a founder moving on or pivoting to new ventures. The New York Times cites Dorsey's exit, Jeff Bezos' shift to space ventures, and even Mark Zuckerberg's pivot to Meta as signs that the tech giants have gotten bored and restless with their empires. But the Times also suggests they're tired of dealing with increased oversight and controversy and are more interested in building something new over fixing what they have helped to create. So it'll be interesting to see what goes on in this regard as well. And we're going to see some more big CEOs and things of that nature stepping down or going into other parts of their business as well. Matter of fact, Grace Atkinson, who is a corporate communications, PR, and marketing professional, said that on Monday, the news of Twitter's new boss, Parag Agrawal, got the internet abuzz and the tech world jittery. As expected, there were a lot of spinoffs over the simple announcement of Jack Dorsey stepping down, from media analysts trying to rationalize to tech communities trying to extrapolate and congratulatory tweets making the rounds. It was one news that people heard, which is that Twitter had been preparing for in the last few years, and it did deliver the needed expectations. But beyond the buzz is a fact so iconic. And that's what Grace was saying, was that, as Patrick Collison, founder of Stripe, puts it, Google, Microsoft, IBM, Adobe, Palo Alto Networks are now run by CEOs who grew up in India. Wish he was here. I wonder what his thoughts about that are as well. However, this didn't start in a day. There was a time when hiring an Indian to work on your IT team was considered a risk. Gradually, it became exciting for companies to have Indians on their team. Then it became a thing of pride to have them on board, and now as CEOs. All their ascension to heights is less of a nationality and more of a quality, hard work. There's a lot to learn about their Indians, their tenacity, and community approach to developments should be an HBS study. So I'm sure that a lot of people will be trying to find out about that and all of that. I do have another guest on, and I'm looking forward to bringing them on and sharing a little bit about the amazing things that they are doing as well. So like I said, always great to have some truly amazing guests that are coming on and sharing their story and what they are all about. So I do have Dr. Faya on, and about to bring her on into the show as well. So definitely looking forward to a truly amazing conversation with another great guest here on the dinner party. So get ready to bring them up and see what they are all about as well. How are you doing, Dr. Faya? How is everything going? Like I said, I just had Dr. Canterbury on, who is a pharmacist, and we were talking about some of the things that are going on here in this area with their things that they are doing to get some of our community vaccinated and all of that. So he's actually got an event on the 4th, and then one of my cohorts here on the International Broadcast Media, Steve Rao, who is a local politician, he was bringing some of his insights into technology and all of that. So I did find you through the wonders of podcast guests and all of that. And I know that you are very much about Oasis. So I love people to learn more about the amazing things that you are doing as well. Because I think a lot of times we don't pay enough attention to great organizations that are doing amazing work and all of that. And you've got a ministry devoted to providing an oasis of hope. And we know that a lot of times we don't see enough of this kind of work going on in our society and all of that. So I'm sure that our listeners would love to learn more about yourself and the Oasis focus.
Thank you so much, Mr. Lee. It's an honor to be with you and your guest, and I missed that conversation with the pharmacist, Dr. Ken. So yes, I think educating our communities on vaccination is so important. And I know some people might not understand the reason behind it, but we know it's really, really important. When they're more informed, then they can make better decisions. So I'm honored to be here with you. So whatever questions you want, I am just ready to share and to serve you and your audience.
I would appreciate that. Well, tell us a little bit about Oasis Focus. I know that you are in a separate part of the world. I'm over here in Durham. You're over there in one of the African nations. So I'd love for folks to learn more about how this whole project came about. It seems like it is a project with not just yourself, but with your other half as well.
Yes, well, actually, Mr. Lee, we're right here in the United States. So I'm chuckling when you said that you are in Durham and we're in another part of the world. We're actually based out of Dallas, Texas.
Okay.
The great state of Texas, or we can say the nation of Texas. So we're here. Oasis Focusing. It's a nonprofit organization that right now our reach is global. So maybe because of the banner that we have, is one of the banner of the conferences that we went and inaugurated 3 years ago, focusing on empowering youth and women. And you know, most of the time in a lot of African countries, not just African countries, some third world countries, women, girls, and youth are basically underserved and don't have access and opportunities, especially in education. And so my husband and I, we have a burden and a heart to really empower our next generation. And we wanted to make sure that not just here where we are in the States, however, also reaching back out to help, some of our youth in different countries. We have partnership in Nigeria, we have partnership in India, and we have partnership also in Asia. So as much as we're able with the resources that we have, we tend to want to share those resources with our fellow brothers and sisters in those communities. But focusing on here in the United States, in Dallas, Texas, so we're based in Keller. Keller is in Fort Worth, not too far from the DFW International Airport. We provide an oasis of hope in 3 major areas: to our public school, to our families, and as well as in the marketplace. And majority of our focus and service is in underserved communities. That means minority communities where we're heavily African Americans or heavily Hispanic or heavily immigrants or heavily Asians, or basically and heterogeneous community. Basically, we're there in helping and ensuring that in our public school, we're mentoring, we have mentoring programs, we have programs for our teachers to encourage them, build them up spiritually. We have scholarship programs for our seniors, especially in the lowest income bracket. And basically, we don't even ask for much. We basically want to kind of reward them for getting that far. And as they move on to college, it doesn't matter whether it's a 2-year college vocational or a 4-year college. We're just basically cheering them and telling them, great job that you are pursuing beyond high school. You have a village and community of people that believe in you. And here is a scholarship award for you to do that. Use it to buy toiletries, things that you need in your dorm room. And we know how that is very helpful to parents. Any parent that has kids in college, if you have 1, 2, you know those costs really ramp up by the time they want to buy new socks, new underwear, toiletries that they need. Those really ramp up. So that's one thing on that. For our families, in focusing and giving them hope, We work a lot in providing opportunities for them to advance themselves, to better their skills, to better themselves. For example, if we have parents that have just migrated here, they don't know what the culture is all about. We basically walk alongside them, teaching them the best practices of assimilating into our American culture. We help them understand the school system, because that's one of the key things that a lot of, even for our communities, don't understand because of this huge gap between the school and the parents. So we let them understand all those. We also help them with different social resources that they have, because we have a huge network of partnership. We can point them in different directions, whether they need information about housing, information maybe about immunization to put their kids in school, whatever that is, we're able to funnel that. Then we provide hope within the marketplace by teaching practices, best practices and principles that empower people to be successful. And one of the key things that we know basically from a biblical point of view is character development is really, really important in sustaining any type of success that we may have. If we get to the very top and our character is not able to sustain that, it crumbles within a short period of time. So those kind of principles, we teach them, their seminars, and most of this things that we do, we're fortunate to have donors and investors, so we're able to provide a lot of these services at little or no cost at all to the audiences that we serve. We want our audience to know that we're coming with no string attached. We're not coming, we want them to be better. We want to invest in them. We want to invest in their family. We want to see them prosper. We want to see them do well. So most of the time, we make sure that we're coming in, no string attached, no fee attached, and we want them to see the purity of our heart, because we understand that in underserved communities, most of them have been misused. Most of them have been exploited. So we want to come there and let them know that we care about you. We love you. This is nothing whatsoever. You don't owe us anything at all. We just want to point to you because our joy is to see you doing well. So those are some of the areas of what Oasis Focus Seek is doing. Of course, we do have a media branch that helps us propagate some of these principles and our work to a larger audience. So we have a weekly TV program called Oasis Connection TV, which basically from the network that we have right now beams across the world. And then we have also a monthly podcast where actually people send us questions. And the way that happened was during the pandemic last year. We were inundated with so many questions, people asking us, what is this? How can we do this? How can we do that? And we started answering them email-wise, even with our team. And all of a sudden, my husband said, wouldn't it be so great that some of these questions, there's so many other people that have the same questions and they probably don't have a means of asking. Why don't we just gather the answers together and just share it for everyone to have access to? Wow. And that was how that started. And people have really, really been so inspired and so empowered that they send us questions every month, to the point that we can't get to all the questions because we have a huge bank of questions. So we pick questions every month. That's how much. Right now, we actually have questions that will last us for the next 6 months. That's how much questions that we have. And so just in means of helping our brothers and our sisters, that because we understand that when our brothers and sisters are doing well, we know they will pass it along, they will pass it forward. And this is how we make our world a better place for everyone.
Yes, and a lot of people are trying to do that. And I know that some of the work y'all have done has been in the work of trying to deal with people that are facing different traumas and things of that nature. So I'd love to hear some of the work that you're doing in that space as well, because I did see that you were doing work for those that are facing different kinds of traumas. And I do know that Texas has been very much in the news because of certain ways that it has been perceived in terms of being a very conservative area. But I'm imagining that even despite that, that you are finding a lot of people that are needing your services and things along those lines. So I'd love to hear your thoughts about how you are working with folks that might be facing trauma in one sense or another.
I love that you asked that question. Yes. And, you know, one of the best ways to serve people is out of your own life experiences, because you've been there. You know how to touch people and how to reach out with a helping hand to say, hey, come on, get up. I know you are down right now. I've been there myself. Get up and you can do this. That is what that wellness is now called the Wellness Project. And the Wellness Project basically looks for a way. So right now, more of the space of a connection resource service. That's what it does. I get the chance. I wish I had more time because I love talking and connecting with people. And so I get the chance when people, schedule a session, a one-on-one session in 15 minutes. I can ask just 2 questions and dig deep down to some of the root causes of what they're experiencing in their life. And once I find that out, I can determine, okay, I think this will be the best route for you to go and work with someone, either a spiritual counselor, and basically sit with them, commit, maybe I normally say commit to 1 month. Commit to 4 weeks, once a week, and work with them and process. Or I will say, you know what, you really need to see a therapist. And then some of them might say, I don't have the money to see a therapist. I said, you cannot afford not to see a therapist. So we have a network of therapists that provide initial consultation for free just for that reason, because they have a heart to help people. They want to see people whole. They want to see people well on the inside. And COVID from last year up till now has done a lot of disruption in the lives of so many people, not just our underserved communities, our minority communities. And we see from depression to anxiety, to panic attacks. There's so much of that. And so what I've been able to do, not only in that liaison service of connecting them to where they need to be, is also the resource from my own personal life story. I have 2 resources in that aspect. One came from my own life story, my autobiography. It's purely biblical. It's purely Bible-based. And when I started working with people with that, I started working with a lot of people that were not so-called Christians, but they wanted to be free. They wanted to be well. They wanted to be whole. And I know that it's an endowment that has been given to me to be able to connect with people no matter who they are, no matter what their background or their faith is. And so working with them, I was able to do a follow-up that basically takes just the principle that anyone that has gone through trauma, and trauma basically means any life tragic situation that happened and basically took us out emotionally, took us out in our spirit, in our minds, and just took us out. And many times we can stay in that state for years, that we're just out of it. We are just totally out of it. And it takes a special expertise from professional licensed counselors or spiritual advisors or spiritual guides to actually guide us out of that space of being stuck in our emotions, that we're no longer awake on the inside, and more or less it's like we're asleep on the inside, but they can wake us up. And they wake us up through different means and categories. I do the first step of waking up by asking 2 basic questions that will always drive to the root cause of whatever their trauma is about. And once people start experiencing a little ray of hope that, wow, I can get back up, oh, I can get out of this, you see that things begin to change for them. So that has really been it's been a blessing from God to be able to do that and guide people, because people are really hurting, especially with what has happened from last year to this year. Lots of people have lost their loved ones. Lots of people have not just losing their loved ones, but even themselves experiencing a breakdown in so many areas, because the whole world was turned upside down due to what happened, with the pandemic.
No, definitely the world was turned upside down, and we've got different people that are doing leadership things and things of that nature. I did want to hear your philosophy about leadership, but I also had another guest that was going to come on, and that was Shivni Gonell. So hopefully I can bring Shivni up as well and everything, and they can come and share some of their thoughts as well and everything. But while I'm waiting for them, and I think they may have stepped away and everything, I'd love to hear your thoughts about leadership and just the role of leadership, because leadership is a very important thing. And I know a lot of people have been having conversations around leadership even at this particular time. So I'd love to hear your thoughts about what makes a leader and what you should look for in leadership for those that are thinking about being leaders.
Great question. Great question. My thoughts and my concept of leadership is totally biblical based, because that is what forms my thoughts. That is what forms the concept or the foundations that I build my life upon. And the Bible gives us the perfect example of a leader. And that is in our Lord Jesus Christ, our Savior. He's the perfect example of what a leader is. Now, for every human being, whether we know it or not, they all have the traits of leadership. Developing it into the person we're supposed to be is the high cost of leadership. And I believe that that's where a lot of people either miss it, or they're like, this cost is too much, it's too high, I'm not ready to pay that yet, I'm gonna leave that alone. So everyone has what it takes to be a leader. A leader is someone that basically, you will say a cheerleader, you will say someone that leads the way, you will say someone that is courageous, you will say someone that takes initiative, you will say someone that helps others, sees the big picture. The bottom line for me when it comes to leadership is servant leadership. A leader is a servant that is entrusted with confidence with the lives of people to help guide it in the way that sometimes they know that that's the way it should go, and sometimes they don't. And if we see ourselves as servants of others, it helps us to be able to understand this aspect of leadership that has to deal with humanity. And humanity is the key thing that either makes or breaks us as leaders. And so my concept is one of servant leadership. Our key role is helping in guiding people as we serve them. We serve them, we don't lord over them, but we're serving them. We see something they don't see yet, but through our lives, through our impact, through our example, through our service, they'll get to see it down the road somewhere. Right now, we can say that if we look at different facets of our world, we're in need of critical leadership in critical areas. That's true. And that's because many times we see leadership in a wrong lens. We see leadership either as a means of lording it over others, or as a means of other people serving us, other people doing our bidding, what we want, rather than seeing that it's an opportunity and a privilege to get to lead others or to get to guide others through a vision. That means you can see farther than they can see. Leaders see further. That's why one of the best aspects of leaders are they're visionaries. They see way ahead, and they see the obstacles too with all the vision. It's not as if they don't see the obstacles, but they know that despite the obstacle, it's doable what they're seeing. So many times leaders see that in people, they see that in us. And sometimes some leaders have not had the opportunity to see others that saw them that way, but through life experiences, they were able to continue till they got to that point and realized that, whoo, I can see now. Now I can go back and help others that couldn't see. Some have been privileged to have people that could see that in them at an earlier state of life and work with them to build their leadership skills. One of those people is Dr. John Maxwell, and he's well known for that. And we have a lot of his books in our home here. So you have people like that that will be able to see and say, I see that, and I'm going to develop that. But I always encourage young people, in case you don't have a mentor that you can meet with, that you can say you're close with, you can have a long distance mentorship with someone that you admire or that you see yourself in. And there are many resources also that young people can tap into, resources of mentoring, resources of leadership. The key thing of leadership is ensuring that we develop a character that can sustain the leadership that we have, whether it's in a faith setting, whether it's in a secular setting, it doesn't matter where, but that our character has that pillar to hold up whatever that responsibility of the vision that we see or we have or we're impacting on the people that we're serving. So those are my thoughts on leadership.
No, I appreciate it. Speaking of leadership, I know that one of the stereotypes that exist about Nigeria, and I actually have some friends that are of Nigerian background and of some of the other African nations as well, is that women don't have as strong a voice as you have, because you have a very commanding voice and definitely have a leadership style voice. And I know that there is a stereotype of Nigeria as being a very patriarchal kind of society and things of that nature. So I was just wondering, have you always been this way, and how do you counter those stereotypes? Because I do know that the stereotype is that it is very much of a strongly male dominated society. Not to say that America isn't either, but definitely that is one of the stereotypes that exists around Nigeria. But as I'm hearing you, I'm going like, this is not the typical image of what somebody would expect of a Nigerian woman.
Well, Mr. Lee, I love your transparency, and I love the question, by the way. I get asked that question a lot. So thank you for bringing that up. So one of the things why I am so passionate about helping people with trauma is because I went through it myself. So you asked, have I always been this way? No. So you are looking at a masterpiece and a work of God. You are just looking at a woman that God basically brought from the pits of hell all through, from the inside out. You are just looking at her. So, and I give all that praise and glory to God. Yes, Nigeria, as well as many other African nations, Middle Eastern nations, Asian nations, are highly patriarchal, whereby the male have the dominance in terms of every single thing, and the women are known to either be subservient or don't have a voice and things like that. I will say that the foundation for me was set with my paternal grandparents. I was born in Phoenix, Arizona, by two Nigerian parents that were here in the 60s, to go to school. And after I was born, I was shipped over to Nigeria, Africa, to go be with my paternal grandparents. My paternal grandparents was a typical model of what life is in terms of marriage, in terms of everything. Why did I say that? My paternal grandfather was what you call a homeopathic doctor. That means an alternative medicine doctor with a very strong personality. And my grandmother, on the other hand, was a retired school principal with a very strong personality, but totally opposite of that of my grandfather. That means she commanded everything. She's basically what we will say in the American culture, that she is the neck that turns the head. And we say my grandfather is the head, but she's the neck. And in her own way, basically held everything together in our home. So I had that opportunity for that kind of foundation, for that kind of upbringing, and that was instilled in me. And I went to an all-girls boarding school. And all girls boarding school is the norm in African nations, especially in Nigeria, whether it's all girls or all boys. Boarding school are just the system of education. I know here in America is different. Boarding school is either for the rich or for the troubled child that you want to send away. In Nigeria, it's just the basic way of education. So while I was in boarding school, and again, it's part of the path that God had for my life, I was one of what you will call the student council vice president. So my friend was the student council president, and I was the student council vice president. So we did a lot of things in terms of serving others and ensuring everyone else was okay, and focusing on others. It started at a very, very young age for me. So that was already instilled in me. However, I encountered childhood trauma that kept me in a state of being stuck for years. And not until when I came back here to the United States and God started walking through my life in different ways, through his word especially, that he started opening my eyes. He started opening those layers, peeling them off little by little. Of course, he had people around me that I was able to get glimpses of what he was doing through them. One of those people, my husband, other people, my pastors, that I've had the privilege to walk under, to serve in their ministries, and some have some of the largest ministry. God gave me all those opportunities, not because I was special, but because it was all part of his design of developing and bringing out of me what he had put in me. The very day he designed me, the very day he created me, he put it there that this is who you are, Faye. And it will now take all these other things for those things to be brought out of me. So I found my voice through the power of the Holy Spirit, through God's call on my life, letting me know as his servant, as his voice, and as he began to do all those work in me, he gave me different avenues and different opportunities to serve people and represent him. And sometimes, in hands back, I probably didn't get it right, then. I mean, I'm 53 years old now, so it's taken this lifetime to get to this point. But now in getting to this point, which is one of the reasons why we have the conference in Nigeria, Africa, to empower women, to empower young girls, to let them know, don't allow anything to shut you or silence you or counsel you, because God has designed you and he wants to use you for someone else. And it doesn't matter the parameter that he uses us. It could be in a home for that mom taking care of her kids, homeschooling them, or it could be in the workplace, or it could be in governance, in outs. It doesn't matter any aspect, but he wants to use every single one to impact another so that their lives also can be better. And if we understand this, we will see that everyone that we meet on our life's journey has a purpose that God has designed in our lives. And when we realize that, our responses to some of the life's challenges totally changes, because we understand they're all divinely put there. They're all divinely orchestrated so that what God has placed in us, what he's designed and written about us, it can all come out. So yes, I have not always been this way, but I am so grateful for the entire journey of life to this point and for all God is doing. And I will encourage anyone, whether you are from an African country, a Middle Eastern country, to find your voice and hold on to it, because it's a gift that God has given you. And one day you will be given an account of that gift. So don't let anyone put you in any point whereby you're going to hide the gift, or maybe someone doesn't feel comfortable with it, you hide the gift. The God that gave it to you will give you wisdom how to navigate all of that. So I'm very aware of the Nigerian culture being highly patriarchal. So that's a great question.
Oh yeah, no doubt. I want to bring up one of our commercials, and then I'm going to try to bring up Miss Shivani as well. So hopefully she's listening and she can bring a little bit of her perspective of things as well. So definitely, I see that she is getting ready. So I'm actually going to bring her up right after this commercial. So we're going to do a quick commercial, and then we'll bring up Shivani to share a little bit of what she's got in mind as well.
Are you looking for money-saving strategies for your business and personal finances? Are you tired of working hard every day with little or nothing to show for it? Contact Prosperity Financial Services, LLC right now for your free financial consultation. Call now to reserve yours today, 804-349-8600, 804-349-8600.
And we'll bring up Shivani. Shivani, you're coming all the way to us from Australia, and that's another person I found through the lovely services of podcast guests and all of that. And I know that you are about definitely inspiring women and definitely giving even inspirations to many women and all of that, but just people in general. And I know that you oftentimes talk about helping women go kind of live their soul mission and things along those lines. And definitely you've been talking about things like consciousness and power and things along those lines. So I'd love to hear your thoughts as to how we are doing even in that regard. Because I actually did a story earlier today where they were talking about that there's been a shift around the way that women entrepreneurs are even being treated during this pandemic and things along those lines. So I'd love to hear your thoughts about that and your own work and some of the amazing things that you are doing, including work around leadership, because I know that you are definitely a person that is in that leadership space as well.
Thank you so much, and hello everybody. So sorry, I'll be very honest. I sort of listened, but I didn't. I did other stuff. So can you ask me the question again?
No problem. I was saying that how important has leadership been in your own life? Because I know that one of the things that you do is you talk about women in leadership positions, and also how even consciousness and power and responsibility all play roles in our leadership. And I don't know that we always pay attention to those things, even though I think that we should. And we were actually having this conversation earlier when I was talking to my guest that was the pharmacist, and we were talking about some of the things that they are doing in the sense of the pandemic. And he was actually saying that he was raised in, I think, one of the African or Central American countries, but it definitely is a fan of holistic medicine, which can sometimes be counter to what is taught in pharmacy. But he's actually very much about being conscious in what he does and being responsible in that regard. So that can even be away from the way that some people may treat medicine. So I was just wondering your thoughts about how we are doing in terms of being conscious business leaders.
Yeah, like personally, I believe this is actually the way to the future, because I mean, what I know, like my modalities are the Akashic, but also human design. And human design already very clearly has mapped it out, basically, that we are in a huge global shift, and we are moving from the systems, like we're moving, like in human design language, we're moving from the right angle cross of planning, which we are still in. Yeah, that's the banks and the government, and like I pay taxes for that. I have my garbage emptied, but all that is basically falling apart because the very new energy that is coming in, and that will be fully in January 2027, is all about individuation, and it's all about abundance in spirit and also purpose. And I think the more you actually know, like, how do I pronounce your name, Dr. Feya?
That's good.
So you know how you said already, the more you can actually trust who you are, trust in God, trust in your intuition, I think that makes a good leader.
That makes a lot of sense. And I was wondering, for both of you ladies, how much do you think that we actually are in tune with our purpose? Because I think a lot of times we're not as in tune as we should be. And what are some of the ways that we can actually get in tune with our purpose? Because I think that sometimes we might think that we know what our purpose is. And I also sometimes think that we let outside voices detract us. But I'd love to hear both of your thoughts as to how we're doing in this whole purpose-driven lifestyle, because I've heard people talking about that, particularly among folks in both the spiritual and the religious community. But I'm not sure how many of us are actually living purpose-driven lives if we actually even have an understanding what our purpose is.
That's a great question. I know I will love to stay on here for a longer time. So I look forward. That means I have to be back with you, Mr. Lee, and serve your audience. So I will soon sign off shortly, for another meeting. That's a great question. There's a favorite quote that says that the day you know your purpose is the day everything changes. However, there's a caveat to that. It takes almost a lifetime, many times, to discover that purpose. So that is why it's so difficult. Purpose is normally not discovered, maybe during the teenage years or college years. However, if you are so fortunate to have people in your life that can see, again, that visionary aspect of a leader, they can see that, wow, I see so many strengths in you, and let me be able to guide you. And I see that. Purpose basically means our life's motto, our life's meaning, our life's essay, our life's keynote, what our life is all about. That is what purpose is. And purpose is God-given. God gives every single human that he has made a purpose. Now, discovering that purpose will take the journey of a lifetime. But once it's discovered, there's something that fuels it. There is a satisfaction that is priceless, that you cannot put anything on. Some people, their purpose simply is to, make pictures. That's how we have those $1 million Picassos. And just by sitting down making those Picassos, they get totally life fulfillment about that. Some people, they can't paint anything. I mean, if they want to paint something, it doesn't give them any fuel of satisfaction. Some people, writing gives them the ultimate satisfaction. I mean, it doesn't matter what it is. So knowing what those purpose is, it takes having specific people that can see beyond ourselves. I love what you said, that many times we don't even know what that is. That's very true. I remember during my college years, I started out in biochemistry. I did not have a counselor that could have seen that Faye is not good in physical sciences. I spent 3 years of my first college life going through biochemistry cycles that I hated. I hated every bit of it. In fact, my first semester of college, I almost flunked out. Why? I was terrible in calculus and physical sciences. If I had someone that would have guided me, it would have cut off that whole part of my journey, right? However, I look back, it was necessary because now I use that for young people. I can quickly see young people, having been in education and say, no, let's go and look at this way. So we're able to see how every aspect of our life wires us for who we were created and meant to be. But purpose basically lights us up. It gives us the fuel and the energy for life. And it doesn't matter what it is once you discover it. That is where your life satisfaction, your life fulfillment, all comes in and comes through. So it's a life's journey. And that's why it's not something you'll say, oops, okay, I found it right here. So for many, they'll tell you it's taken years to finally say, wow, I found it. And I'm loving it. And I'm loving every aspect of life. So
That makes sense. Shivani, what's your take on purpose and how purpose even plays into business? Because I do know that you mentioned the global shift and reset, and we do seem like businesses are changing their mindset and even the way that they're doing business. I've got some friends that are very much involved in crypto currencies and things of that nature. And that seems like that could be even a change in the way that the things are being treated on a business standpoint. But I'd love to hear your thoughts about purpose and maybe this whole reshift and change in society that we're in the middle of. I've got a good friend of mine that talks about the light warriors and there being a lot of light warriors out there in the world, and not just in the United States, but in Australia where you are and various other parts of the globe that are trying to bring positivity to the world.
Okay, first of all, I really loved what you said about purpose. Let me back up. So what I see with our society is that as soon as we are born, we are actually actively led away from our purpose. The reason being is that as society, we make the brain, the intellect, our God, basically. And purpose is all about body and emotions and feelings. Yeah, because what I see is most people are cut off from their head, like they're walking around from their head down, up, and they don't bring themselves with, yeah. And if you are in your head, if you're just using your brain, there is no way that you can find your purpose. Now, the other thing is, as the other speaker said, it's a life's journey, and purpose is not something that's written in a cloud somewhere. You know, God says, this is your purpose, and you go, oh my God, okay. It's like, I think purpose is not static. Yeah, purpose is really, what are you best at? What can you do that you love doing and you don't even care whether you get paid or not? What makes your heart sing? Yeah, and for me, because I work only with entrepreneurs that work with people spiritually, so their business is in some shape or form a transformational business. And so purpose is the extension of your business. Yeah, because you are the business in that case. You're not in a shop selling milk, yeah, where you're removed. If you're literally selling yourself and you're offering your services. And so the rules are then very different, yeah, because then, because in the Akashic, there is such a thing as a business record. Yeah, we look at the personal record first to determine who are you at soul level, what are your divine gifts, what's your life lesson, what's your soul specialization. And yes, it will give you a roadmap, but because we have free will, then the lens is what makes me the most happiest. Yeah, how do I express that? If that makes sense.
No, that makes a lot of sense. And the other thing that I've been noticing, and I don't know that we're prepared for it, but I'd love to hear your thoughts about it, is that a lot of people are having to adapt. And I know that you had talked about how for a lot of times we had got caught up in cookie cutter kind of mentalities, whether that was the cookie cutter ways of building houses, the cookie cutter ways of running businesses, or the cookie cutter ways in a lot of things. As a matter of fact, the two founders of this particular network, International Broadcast Media, oftentimes complain about our education system because they feel that, at least here in the United States, and I imagine in other parts of the world as well, that we are in the 21st century, but that we're teaching with 18th century values. So we're not doing enough to teach about STEM or to teach about the more modern days ways of doing things. And I kind of agree with them on that. And I was just wondering, are there ways that we can actually get out of these cookie cutter mindsets? I do think that a lot of times folks are stuck in those cookie cutter kind of mindsets. And I think we're even seeing that with the way that we're moving into this hybrid kind of business model, because a lot of people are, I don't know that they're ever going to go back to being 100% back in their office. Their office will probably be partially at home and partially and whatever the physical building is. And in some cases, they may never go back to the physical building. But I was just wondering, is that part of the shift that you're seeing?
Absolutely. I see many more people are now willing to go online. Yeah, before, like, in a way, I see lots of good stuff happening. Yeah, because I know in Australia, and I think also in the US, that people are not going back to their jobs because
Right.
they suddenly woke up and went, hell no, why would I, slave away for this minimum wage? There has to be more to life. Yeah. So yeah, what the cool thing is, but that is the background frequency that we are under already, is that people are now really looking, so what is there for me? What do I like doing? Yeah, so I see a lot of people going online or trying to go online. I see MLMs actually doing really well. And what I see is, in general, that people are craving authenticity. Yeah. So if you have an online business, like say even 5 years ago, you had some very glib people, with the Porsche or the house in the background, and like none of that flies anymore. It's really about connection, being real, being open, being honest with people. And that's, what people are craving.
I definitely agree. There's a term that you've talked about in your background and everything, and I've heard people use this term forever. And I know that it comes up in relationships, it comes up in business, but I don't know that anybody really has a true understanding of what it means. So when you hear the term law of attraction, what does it mean? Because like I said, I even hear it, and I'm still single at my age of 59, but I've heard it talked about in relationships, but I've definitely even heard it talked about in family relationships, and definitely in the business. So when you bring up that term, law of attraction, what does it mean and how does it work?
Okay. So if I make it really simple, I would say that we are energy, we are vibration. Everything is vibration. Even the chair that you're sitting on, it's just vibrating differently. Yeah. And so the universe is responding to vibration. And your vibration is a mixture between what you're thinking, what you're feeling, your environment, the people that you are around, and of course your upbringing and any past life that might leak through, so to speak. And so, yeah, so that for me, that is the law of attraction. It's literally, the universe is like a Xerox machine. There are no favors. It's literally, okay, it's a Xerox machine. Whatever you put out, it prints out. Yeah, so it's actually a very immediate feedback. Yeah, so basically the life that you're living right now, warts and all, is the law of attraction in action, and the past decisions you made years back.
And along those same lines, don't you feel that sometimes, and I'll even admit to myself being guilty of this as well, that sometimes that even when we, if I can use a cliche, even when we know better, we don't always do better, because sometimes there are signs of that law of attraction that should probably be the law of distraction, meaning that you know that the people are bad for you or toxic for you or not good for you, but for whatever reasons, you decide to still go into those relationships. And I say that can be done in business and in your social life. And I can say that I've probably been guilty of both of those situations, because definitely I've been in business arrangements where I know that the other partner is not necessarily good for my health and my well-being, but for whatever reasons I may decide to stay in that, partially because I'm a very giving person. But I was just wondering, do you sometimes think that we can do things that are contrary to what we should be doing?
Yeah, and that, I think, boils down to not knowing how you are wired to make a decision. Yeah, and that's, for example, where human design comes in, because as long as you know your birth time, and your birth date,
Right.
I don't know if have you heard about human design? Do you know that?
I've heard the term. I'm not that familiar with it. I'd love to hear a little bit more about it, but I've heard the term. I'm not going to say
Yeah.
that I'm a student of it.
Yeah. So basically, very quickly, human design works with astrology, so Western astrology, but also the I Ching, the energy centers, the Kabbalah, and they use Western astrology as the personality, as your mind, and then they go back 88 days, and that becomes your design. Yeah, that becomes your body. And we have in human design, there are basically 4 energy types. Like you can go online, type in human design chart, you will get a free chart anywhere online. Okay, like anybody can do that. And then you might see, oh, okay, I'm a generator, or I'm a projector, or I'm a manifester. Yeah, there are different types. Literally how your energy works, but also how do you specifically make the right decisions for you? Like, where is your intuition situated, so to speak? Yeah, and that can be vastly different for people. So, for example, 50% of the population usually have what we call emotional authority. Now they are basically running the emotional wave constantly. They're up, they're down, they're up, they're down. Yeah, that's normal. And when they make a decision, they have to wait for the curve around 70% to a place where they feel at peace. And they actually need time to make a decision, at least 24, 48 hours. So emotional types, when you said, well, sometimes I make the wrong decision, yes, you do, because you don't know how you're wired to make the correct decision. Yeah, so emotional, they need to sleep on things, or it can take longer. Like they have to really come to a place where they feel peaceful, because quite often these people would make, like if you're on the high, you would go, oh my God, yes, I want to do this, right? Or then on the low, and you don't want to make a decision, on either extremes.
Yeah,
And that is, that's something that can be taught. You have another type that is sacral, and it's literally the sacral area, and that comes with sound. Yes would be aha, no would be Yeah, and really learning, because it's in the body. Yeah, that's why I said we are so trained to be in our minds, but the intuition, the knowing, the soul part is in our bodies.
Yeah, that makes a lot of sense. There's been a push lately toward what some people might call social entrepreneurship or social impact entrepreneurship, but there are still quite a few people that do the old-fashioned, what I call Wall Street capitalism and things of that nature, which is definitely not people-centered, and it's probably the furthest from people-centered. So, do you think that we are going to see a shift in business where we will see people doing more business and kind of capitalism, or maybe even some of the other economic systems that will be geared more toward what some people might call social impact or social justice kind of entrepreneurship? Because I know that there's still quite a few people that are in the business of business to make money, and there are still quite a few people that have that attitude of our past United States president and things of that nature. Or do you see a serious shift in the way that business in general is being done?
I dare to say that I think we're seeing a shift already. I mean, there'll be always people that, I just want to make money and cutthroat, but I think that is part of the shift. Yeah, like my sense is the shift will be more locally communal, and it's more, like as soon as you start with even just learning about your purpose, for me, that means that your heart is open.
Right.
And as soon as your heart is open, you won't be cutthroat.
Mm-hmm.
Yeah. Like
Yeah,
the people you see cutthroat and money and, you know, all that, they are all mind.
because the other thing that I'm seeing, and I think some people see it as a positive, I know some others that don't see it as a positive, is that in the business community, we're seeing more people that are trying to address not just their employees, but just social justice issues in general and using their corporate power in order to bring out those issues. I know that there's been a lot of conversations here in the United States about corporations taking stands on LGBT rights or on Black Lives Matter rights or a number of other issues. And I think that that's a global trend. But I was just wondering, am I correct in that we're seeing more of this? And do you see that as a positive as well?
Well, I think in general, when I said at the beginning, with the right angle cross of planning that we are under, and the way to understand this, it's literally holding, like we talk about a background frequency, but that background frequency literally dictates how people behave. Yeah, it's actually like a lot of people don't realize that, but it does. Yeah. Like I said, the system as we know it is falling apart.
Mm-hmm.
And that falling apart also means we have to bring to light every dirt that we literally put under the rug. Yeah, from like the trial at the moment, yeah, Ghislaine Maxwell to Black Lives Matter, like all that is sudden, like it's been there all the time, yeah, but it's been suppressed. Yeah. So all that is now coming up in order to be healed.
Yeah, that makes sense. You definitely have to have those things come up in order to be healed. I had mentioned earlier that Nick Palveda has talked about the fact that he wishes that more of us had an understanding of financial responsibility just in general. Like a lot of people here in the United States, I'm not sure about there in Australia, don't know, how to balance their own budgets or how to do the basics of accounting. And there are even business people that don't have the basic business plans or the knowledge of how to do a business plan or a pitch deck. And of course, even some of the other skills that you need in life, like home economics and cooking and things of that nature, aren't necessarily as taught as much as they used to, at least here in this part of the West, the United States and everything. But I'm just wondering, is that something that you're also seeing in Australia? And is that something that is part of this grand shift as well, that we will see more people learning the basic skills? Because right now there's a lot of the folks here.
Yeah, the whole shift is really towards being sovereign. Yeah, because doing when you live your purpose, you are sovereign. Yeah, but for me, it's like you're in this energy. You won't be able, what's the word? To be. There's a particular word I can't remember, but basically, if but bribe, like you won't be able to be bribed in any shape or form. Yeah, when you know this is right for me, eventually it's like, well, shoot me, I'm not doing it. Mm-hmm. Yeah, and with that comes being sovereign, being like, I think what we are looking at is we have to stop making the government our parents. Mm-hmm. And we need to become self-sufficient or we have to come back to what can we do as people versus looking for the outside, help me. Yeah. And with that, yes, we have to learn more skills. Some of us have to learn more skills.
Yeah, that makes a lot of sense. And it's interesting you say that, because I know that a lot of times when I've talked to people, even on this show and other shows that I've done, we've talked about the world philosophies. I won't even call them world religions, even though some people may use that term. But a lot of times they all have the same basic tenets, which is, respect your parents, respect Mother Nature, respect certain things and everything. But I think that sometimes it's the extremists on both sides, whether that's the left or the right, they get in the way, and we get into these personalities. And it seems to me that what you're seeing is a shift away from that. So I don't know that we're going to have as much
No,
of
because
those.
we are. Because I mean, that's the cool thing, you know, like the background frequency that is holding our planet, whether you believe it or not. But the invitation now is really to do your purpose. Who are you? What do you believe? You know, and you see it play out already. Like what I see at the moment, it's what's you know, what's playing out is the system basically saying, we want you to take one for the team, say with the vaccinations, and some people say, no way. Yeah, and it's like, and you might notice that more, like what I see in general, people can't agree anymore on anything. And that is part of the individuation.
Gotcha.
Yeah, at the moment, I mean, we are not through yet. Yeah, at the moment it's chaos. It's like, nobody agrees on anything because that's part and parcel of who, you know, at so level we are all very unique, very different. And that's playing out now. And the cool thing is it's really an invitation now. Who are you? And, you know, what is your purpose? Why are you here? So, you know, that is what's now being asked of us, really.
And speaking of purposes and why people are here and things of that nature, I've noticed something, and I'd love to hear your thoughts about this. And maybe I'm wrong and everything, but I definitely noticed it with the pandemic, but I think I noticed it even before the pandemic and everything. I, to some degree, feel that I am, and I know that you are fans with your dog because it's mentioned in your bio and everything, but I am very much, I think, in tune with a lot of animals around, like my neighborhood dogs and things of that nature. And it seems to me, and this may sound interesting or maybe even bizarre to some of the listeners and everything, but it seems to me that there is a closer bond between us and our pets, even if they're not our own individual pets. So it's almost like in this shift that we are becoming closer to some of our animal kin and some of our folks that are attached to us and things along those lines. Maybe that's just wishful thinking on my part, but I was wondering if that's something that you're picking up as well, because it seems to me that I'm not saying that people weren't walking their dogs and doing their dogs and going around with their dogs before the pandemic, but it just seems that the bond between man and pet, man and animal life in general is stronger. But just my perception.
Well, I got a second dog during the pandemic. I got a puppy. Well, I think, you know, I mean, our animals have always been amazing because they really hold the energy of unconditional love.
Right.
Yeah. And especially because a lot of people are in fear at the moment because of the uncertainty. Yeah. And animals, they are all energy, really. Like they are, they respond to energy. And they hold the energy also of unconditional love. And I think that is what we are craving for at the moment.
That would make sense. And it also seems like a lot of people are having, and I'm not saying that this hasn't happened before, and you actually alluded to it a couple of times, but it also seems like we're having stronger relationships with our ancestral past, with some of our ancestors, whether that's them communicating through us through dreams, or whether that's through them maybe even having more direct kind of communications. But is that something that you're also observing there in Australia? Because I have noticed it does seem like there is a greater tie to our ancestral past.
Yeah, I think the veil is lifting somehow. Yeah, but it's part of, you know, if it's true, and but whatever you want to call it, you know, the universe, God, and it's now, okay, humankind, time to do your purpose. You've done all the other stuff, so let's come back to spirit, right? So if that is true, now I lost my train of thought.
Right. We were talking about the connection to the ancestors and whether there was a strong.
So you will get help from your ancestry. Yeah, you will get help in any shape or form to the degree that you're open to. Because, we are not usually, God is not cruel and goes, well, I want you to do this, but haha, you can't have it. Yeah, I want you to do this, and I'm throwing everything at you that will help you. If you choose to listen, and going back full circle, that means not to stop being so busy being in your head, and to be quiet. Yeah, because that's why so many people have problems with what am I good at or who am I, because we're just running around like crazy, really. Push, 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 do. It will not happen that way. Yeah.
No, that makes a lot of sense. And I've also noticed that, and our previous guests may have disagreed, but I've also noticed that some of our, lack of a better term, our more established churches also seem to be more open toward at least having conversations about other aspects of spirituality. Like I've learned that some churches are even acknowledging the role of astrology in the holy books and the role of some other things that exist in there and everything along those lines. So it does seem that, not saying all leaders, because there are definitely some evangelists that would not go for that at all, but does it seem like there are more people that are at least open to having dialogue about the various aspects of spirituality?
Yeah, and ultimately we are moving to self-empowerment, even in within the spiritual realm, versus the old doctrine in some of the churches. It's like, well, you can't have a direct access to God, you need an intermediary. Yeah, and it's about ultimately control and power over. And again, you see that loosening, because we're moving into purpose, which is always individual.
What is one of the
And
most?
it's always really about empowering, like what I see is we're literally moving into, I am the master of my own universe, or I'm the creator of my own life. Yeah.
Yeah, that makes sense. When you talk to the different business leaders and the different folks that you consult with and everything, what is the number one mistake that you see that them making, whether it's in their investments or just in their day-to-day business life, other than not being
Yeah.
in tune with their purpose? What are some of the other great mistakes that you see them making?
I can tell you what I see over and over is that people are working like crazy. And because that's what they were taught. And like basically they're working too hard, they're burning out, they don't get results. And the cool thing is, when I actually work with people, first of all, usually half of what they're doing I pull. And depending, it's very individual, right? Like the way I work is very much through the lens of who they are at soul level. Yeah, so the guidance is individual, but my clients are usually mover and shakers, and they're doing way too much, thinking they have to hustle in order to get the money. And once they can actually surrender and relax and focus on what is aligned for them, what actions in business, what marketing tools, or what is actually aligned, they're usually amazed that they do half the work and they get more money, because the money is it's almost like a side effect.
Yeah, because it seems like a lot of times our business leaders and just people in general do get caught up in not paying attention to all the aspects of their health. I know I'm even guilty of that as well, because we know that we are definitely physical beings and we're definitely mental beings. I would argue definitely also to some degree emotional and spiritual beings. But while I do see quite a few people that might journal or meditate or pray and do that aspect of their emotional I do know that in this pandemic, a lot of us have gotten away from our physical, myself included, because I need to get out and do some more exercising and everything. And I don't know that any of us were doing enough on our emotional side, because a lot of us don't even get enough rest, because like you said, we're in that go, go, go kind of attitude. And, maybe we go to bed at 12 or 2, and then your body for some reason tells you to get up at 6 or 7, even though everybody from the scientists on down says that you need at least, I think, 7 to 8 hours of good rest and all of that. But I don't know how many people in the world are actually doing that, just because we have this kind of rush mentality. And we even see it in our diet choices, because a lot of us rush to the fast food restaurants because it's something quick and that we can get to very fast.
Yeah, and look, I know it's almost boring to say, but it's true. You are what you eat.
Right.
Yeah, and for me, it's about balance.
Mm-hmm.
But also, again, we are individual beings. Like, one diet doesn't fit everybody.
Right.
Yeah, so it's a matter of finding out what works for your body, and do the fast food occasionally, but don't live off it.
Yeah.
It's so important. It will, like, what you eat will literally change your brain. Yeah. Sometimes, like when people have brain fog, or they're tired, sometimes it's food. It all, we can't leave out our body, because we're here in the physical.
What are some of the
I
know your book is titled The Book of Inspiration for Women by Women. Who are some of the inspirational women that have motivated you in your life, and what are some of the inspirational messages that they gave, and were they just geared toward women, or were they messages that were universal that man could take heed to as well? But who are some of the inspirations that have really inspired you, and are they modern day people, or are they both modern and historical?
Gosh, big question. I used to, when I say used to, I still do, but I'm not watching her. So Oprah actually made a big impression on me, because she really is the, she basically showed everybody how it's done. Yeah, you can be growing up poor, black, get sexually violated. Yeah, she had a hard story to bit by bit, like, really, because she cottoned on to her purpose, or what she is good at, and then along the way also took risks and really followed her guidance. I can't remember a quote.
Okay.
Yeah, actually, I remember one where she says, if you don't know a prayer, all you need to do is say thank you. Yeah, so going back to gratitude.
Yep, gratitude is very important. I don't know that we do enough gratitude, even for the small things and things along those lines. I mean, we just came out of Thanksgiving here, and of course, everybody was doing gratitude. Well, not everybody, but quite a few people were doing gratitude prayers during that particular day. But I think that Thanksgiving and those Thanksgiving prayers probably should be done on a regular basis, and not just on that one particular day of celebration. But they probably need to be done on a days even outside of Thanksgiving, because I mean, you're asking for people to give you positive prayers and positive wishes for family and for career and for a number of other things during that day. But I don't know why we just have to stop it on Thanksgiving and don't do those prayers on days outside of that particular day.
I agree, and I think you can, that could be a spiritual practice for somebody who resonates with it, because you literally can train yourself. Yeah, like I notice it in my own life where good stuff happens. Yeah, and the tendency is to gloss over. And I've now really trained myself to make a big deal, like internally, when something really amazing happens, because again, it raises your vibration. Yeah, it gives the universe the sign, give me more, bring me more. Yeah. And it could be a little like we actually, I think anyone who goes through life every day, there's some good stuff happening. And we need to attune ourselves to it.
Yeah, we definitely need to tune ourselves more than we actually do, and things along those lines and everything. What are some of the not just inspirations that you got from books, but what are some of the things that have shocked you about your business clients that you have been either pleasantly surprised by, or you're surprised that they are still in that mindset in the 21st century? So what are some of the either pleasant surprises with your clients that you have really enjoyed, and what are some of those things that you're like, wait a minute, this is the 21st century, I can't believe that they still have that kind of mindset?
Look, I don't have clients that I have a hard time with, because I'm very clear who I want to work with. And usually it's really wholehearted yes, and it works. So I have, like, in general, because I work, with some people longer, and what I do notice is like month 3 or month 4, outcomes, I'm having an affair along the side, or, outcomes, the secrets. Because of course this, when I said we are energetic beings, people might say, hey, Shivani, I'm hiring you, I want to double my income. And that's okay, fine, that's the intention. But because we are energetic beings, if you have an affair that you're holding, you're being, secretive about, and it's not about judging anybody. Like I don't judge, but if that brings up feelings and thoughts that are on the negative scale, it will affect your business. Yeah, it's like, that's why I said before, you are actually the business. Yes, of course, there are certain ways how to conduct the business. Look, I'll give you an example. So I worked with this beautiful healer from the UK, and I got already the husband, the relationship. But of course, it's not up to me to tell somebody, leave this guy, okay? But we talked about it, and and we worked on her being more empowered. For example, she actually wanted to go to bed at 9 p.m. He was a night owl. He wanted her to sit next to her when he watched TV till midnight. She did a lot of stuff she really didn't want to do. And so we worked on that, because her biorhythm was, I prefer to get up at 6 and be in bed by 9, right? And not feeling guilty that, the husband basically made it known that he wasn't very pleased when she wasn't watching, right? So anyway, and I worked with her for 6 months, and she got more money in, so she shifted some. And 6 months later, and she stopped, and that's fine. 6 months later, I got an email from her saying, oh my God, just wanted to let you know, I've decided to leave my husband. I'm in a new house, and my business quadrupled. Yeah. Now, I'm not saying leave your husband in order to get more money, but, with her, in her case, that's what had to happen.
Right.
Yeah.
Yeah, that makes a lot of sense.
So,
Yeah, that makes
and
a lot of
that's why, I tell you what, that's why also doing your purpose is so hard for most of us, because your intuition will not be logical. And we all have it, right? But if your intuition says, leave that rotten marriage, move overseas, do this, right? You hear it, and then you go, no, I can't do that.
Right.
Yeah. Because quite often we don't want to hear the guidance because it makes us highly uncomfortable, and we don't want to rock the boat, because that's what's actually needed to do your purpose. Yeah, you will leave people will leave you. I mean, not necessarily marriages, but
Exactly.
as you shift and change, and as your vibration rises, everything that is not vibrationally congruent anymore will leave your life if you let it. Yeah.
Yeah. And I know part of the other things, I must get you back on in another show in the near future and everything, so we can depack a lot of more of these things. But I know that here in the United States, we talk about manifest destiny. And I know that part of the things you talk about is demystifying manifestation. So I'd love to hear maybe just a little bit about what you mean by that, because here, a lot of times we even think about America having its own manifest destiny and whether we're living into that purpose or not. But that's been part of the historical conversations that have been going on for decades, if not centuries.
Okay. Yeah, I don't know what I taught around that, but what comes up is that, and I'm talking to the spiritual people here. Yeah.
Right.
So there is still this idea that if you do your purpose, you will feel good. Yeah, you feel peaceful, you feel good, everything is fine.
Right.
But when you say, okay, you say, I want to create this business and I want to make whatever, $5,000 per month. Yeah, that's the intention. That's what you want to manifest. What people don't realize is you will be uncomfortable as you go about manifesting. And it doesn't mean that you're not on the right track, because you will have to learn new skills.
Right.
Yeah, like basically the journey is from point A, where you are right now with everything that you are. Point B is already the manifestation. Yeah, you've got what you want. And the journey is really to move vibrationally and clear and shift whatever is in the way for you to actually get what you want. And as soon as you can be it, you've got it. Yeah, and the demystification is that you need to learn, and that's another whole talk, what is actually your soul, what's your ego mind, because the ego mind will always come in, try and sabotage you, learning how does that look like. Yeah, and also the idea that I have to be happy and everything has to be fine all the time. No, sometimes you don't feel like writing an email. You still do it as a business owner. Yeah. No, or you're scared you do your first Facebook Live. Well, you have to go through that in order to get to the other end. But I see a lot of spiritual people, I don't feel good. I must be moving in the wrong direction. Ooh, and not true.
Yeah, that makes sense.
Yeah.
How do we get out of our own heads? I alluded to it earlier, but definitely I think that, and it's been a conversation I've had with other guests as well, because I think that too often we listen to that nagging voice of doubt, and this with all of us. And then if you add to that, then you get the outside voices of doubt as well, whether they're coming from family members, peers, or close associates, and all of that. I think that you have to listen to the voices of doubt from your nemesis, or if you have any such things along those lines. But definitely I think that we have a habit of listening to our own inner conversations that we're having with ourselves, as well as those that are supposed to be our allies. So I was just wondering, as a spiritual consultant, how do you get people out of that nagging habit as well? Because I think it's a very common habit.
You mean the habit of not listening to your guidance?
Well, not so much not listening to your guidance as listening to those guidances that are like the voices of doubt, and the voices of those even your internal voices of doubt and everything, when you know that you are supposedly on the right path. Like I have
Mm.
friends that are musicians and they may be having folks that may be trying to tell them, don't do this or don't do that. It'll never succeed. It'll never fly. I know we hear that in the business community, and I know that I have probably self-sabotaged myself out of jobs that I should have gone for, because there's always that doubt of actually going for the job because you are afraid of rejection. So that's those self-doubts that I'm talking
Mm.
about.
Right. Okay. Look, I mean, again, there's no logical answer per se, because I see it many different prongs. So one is, I think we all need, I dare say that as humanity, we need to start healing our childhoods, our beliefs, because especially from babyhood up till 7 years, whatever is told you, it's just landing very, very deeply. And the child believes it's like everything that comes towards the child automatically believes it's my fault. Yeah, daddy leaves where there must be something wrong with me, but it's subconscious and quite often unconscious. Yeah, so there's one layer of working with your inner child, because quite often we react from the wounded child rather than being the adult.
Right.
Yeah, so that's one layer. The next layer would be the more you can really learn how to, like I said before, what is your intuition? How does that show up within you? And the more you can act on it and then have a positive outcome, you become stronger. You believe in yourself more. You trust yourself more.
No, that makes sense. I
Yeah.
know that I've got some friends that are part of a puppet troupe. They've actually got me involved in it as well. As an audio cartoon troupe right now with the hopes of being an actual puppet troupe. But I know that the founder, IPC, oftentimes talks about the fact that we oftentimes don't allow ourselves to maintain some of that childhood wonder. That I'm not saying that you don't want to be an adult, but sometimes we suppress that childhood wonder that we probably all need as well. So I was wondering.
Yeah, absolutely. Like that is, I talked about the wounded child that needs healing, but we want to bring more of the magical child. That's the energy that you're talking about. And yeah, I agree. And that is about having fun and being in the moment and playing. And it's about beingness. And the more you can actually be in that energy, the more you manifest. Yeah,
that makes a lot of sense and everything. Well, as we get ready to wind down, and I definitely do want to have you come back because I've been thoroughly enjoying this conversation. I've got all kinds of other questions, but I've also got another show that I've got to produce.
Yeah, no worries, Mark. Love your questions. Happy to come back.
Thank you. I appreciate it. One of the things that I was curious about is just really quickly. Well, there's a question that I asked all my guests, did not get a chance to ask Faya and everything, but it is one that I usually ask and everything. And you've kind of alluded to it. But before we get to that, we have one of our guests from Australia. I think he's in either Sydney or Perth, but it's not your Providence and everything. But what is one of the stereotypes that you find that people have about Australia that you wish they did not have, other than the fact that y'all are all the way on the other side of the world, and a lot of people wish that they could go visit, and it's not an easy trip because it is on the other side of the world and everything. But what are some of the other myths that surprise you that people still have about Australia?
God, I don't know. I mean, sometimes Australians do act badly. I've seen them in Bali, like swigging beer and getting drunk and rowdy. And I don't know. I mean, look, our country has changed. What really attracted me, because you probably hear it from my accent, I was born in Germany and I arrived in Australia in 82. And it really was the lucky country. Like, I mean, I grew up in West Germany, but we were like, I grew up with, I had to have my passport on me all the time. And it was really a police state, although it was West Germany. And so coming to Australia was like, oh my God, the space, the humor, Australians, we're in the lucky country, she'll be right, mate, that sort of stuff. Unfortunately, we've lost it.
Yeah.
I don't think we have democracy anymore, to be honest. But yeah. So I don't know. I mean, even what is an Australian? We are multicultural. There is no such thing as, except the caricature, Paul Hogan, Crocodile Dundee, whatever, the thongs and but it's not a typical Australian.
Yeah, I understand. I can see that. And I've definitely met people from different parts, and it definitely seems like different personalities. The question I was going to ask is the kind of the going away question. And like I said, definitely hope to have you back on in the near future is how can folks reach you? So it's actually a two-part question. So how can folks reach you on social media and on the internet? And then the question that you've kind of alluded to during this whole interview and everything is, we are an international platform heard in about 150 countries and all 50 states, sometimes in what my friend Brian calls Team Replay, sometimes in Team Live. So any word of positivity that you would leave for our global audience. So those were the two questions, how they can reach you in any words of messages of positivity.
Yeah. Okay, I might give you the website because that's probably the easiest because my name's already written. So it's shivani.com.
Okay.
And if you want to write to me, it's shivani@shivani.com. I think the passing message is stay strong. Don't get caught up in the mass fear, and know that we are actually moving into exciting times. It will be positive, and it's all about now demonstrating that you are spirit in a body, and being, demonstrating that you are the creator here on the planet. And no matter what happens around you or outside you, nobody takes away your intuition and your purpose.
Wow. Amazing message. I appreciate you being on. Appreciate Delon being on. Steve being on, as well as Faya, and definitely appreciate you, Shivani. And hopefully I'll get all of y'all back on at some point or another on the online dinner party. I usually have my mystery guest clues, but that did not happen this time, even though folks, if they're watching LinkedIn, they do know that I gave one of the clues that I will pass on next week when we will have 3 mystery guests. And by the way, Shivani, the mystery guest is like a trivia contest. So I give them a bunch of history facts and history information and things like that. And then they're supposed to guess who the mystery guest is before I reveal the picture. So in the past, it's been folks like Dillinger, because it might be people from the world of crime, or it might be the people from the world of politics. I think one time I had an English person that was one of the English politicians that used to walk around either with a lion or a tiger. And I don't remember her name off the top of my head, or it might have been folks like Shakira, but it's also Jim Thorpe was one as well. So there might be people that are either exist now like Shakira, or were people in history. And I did say that one of the people, and that was the clue on LinkedIn, was going to be somebody that was known as a women's leader and all of that. So I did have somebody that guessed, I think, the correct answer in that sense. So they will have at least one clue right of the 3 and everything. So they've got a head start, but I will bring that back on next week on the 8th, because that'll give me some time to figure out what the other 2 will be. So I gave you on LinkedIn. And like I said, I have thoroughly enjoyed having you on, but I'm going to bring this airplane that gets us on out of here, which is kind of our intro, outro that we use, that it features some of the founders of this particular network. But I do look forward to having you back in the very near future.
Thank you so much, Mark. Thanks to all the folks that are listening. And here's to divine self-expression in business.
Sounds good. Look forward to it.